Always on the grind, yeah, I do this all the time. Go wake up in the morning, go get a state of mind. I done feel so many times, but I gotta keep trying. I ain't giving up, go put it all on the line, yo.
Oh wow, oh wow! Look at it, he got one jigaboo, two jigaboo, and baby jigaboo in the back. Look at this little jigaboo. I can't move out the way. God damn it, a little short ass. He in there somewhere. That little jigaboo, that little white baby in the background somewhere. What up, Mayo? Anyway, how y'all doing? Today we're going to be talking about the bullshit ass scam of the healthcare system, Medicare, Medicaid, goddamn insurance, co-ops, all the good shit that people say is good, bad, and indifference. We're going to tell the good, cons, and the bad about it. If you got anything you want to bring up about this shit, hey, always come to the forefront, drop it in, and we'll watch it. Okay. Goddamn. Little dinosaur baby right there. Anyway, other than that, man, we're gonna be chilling today. Well, he fell asleep on the golf cart, so he becoming one of us. Yeah, he's really one of us now. He sound like my middle son with the whole growling and shit. Anyway, yeah, let's shoot the shit for a while before I start bringing up these videos and start playing some of the shit that we have. Yeah. Anywho, wow, that was terrible. What up, jigaboos? Hello, y'all niggas. Oh, not in here. Okay, that's what it is.
Okay, wow.
This little white baby. Look at it. That's a little white boy for real.
This nigga Zumba said, "Hey, good white people."
Let's go. It's hot in the bitch in here right now. God.
Nigga, of course, nigga, you
gotta turn it down.
You would expect that, sir, when she fill it up with people.
Well, no, it's because I had on 80.
Oh, you had the heat on?
No, I had the AC on 80. I didn't turn the heat part on because if I turn the heat part on, it's gonna come in. It's gonna turn to hell in this bitch. It's different. That shit hit different, boy. Oh, it's terrible.
Tell that nigga Blue Eyes to get on up, use them arm strength. Nigga go stand up on them legs. Bye.
He about to do it. That's all he do is stand himself up. Oh, they ain't gonna help his ass. And they been doing shit all goddamn day. Yeah, that boy something else. Anyway, he ain't did a lot of crying. That's what I was talking about. He ain't did a lot of crying in here. You got 5 people in there. Is it 5 in here? Yeah, it is 5. If you want to say 4 and a midget, we can do that. Yeah, but it's not because of the 5 people because I put that bitch on 80. Anyway, LA, what do you think about our medical system, our healthcare system? Not medical, healthcare system. If you're still there. If not, it's all right. I'll ask OG. What do you think about our healthcare system, sir?
Trash.
Oh, my bad. I don't really care about it, to be honest with you. Because I got it. Never affected me.
It doesn't affect you. Okay, yeah, I'm with you on that one. I'm kind of the same way. So everyone knows I go through VA, but I do have TRICARE where I can go out to actually go amongst the people, but I don't. I'm kind of content with my VA healthcare, but some people hate it. Some people really fucking hate it because it's government ran fucking insurance, pretty much, or government ran health insurance. It's been good to me everywhere I've been, so I can't say that I actually hate it. But there are a lot of people that hate. I think. Let me drop this link. Mayo, do you hate your health? Do you hate the VA where you at? The only thing I know about my VA is they usually give me whatever I want. All I gotta do is ask for it for the most part. But the thing is, I feel bad using it like that because it's a lot of fucking fraud out there. There's a lot of shit that I don't need. Like I told you, I got like 9 motherfucking inhalers in my motherfucking cabinet because they just give the shit out to me like candy. But everyone else, like I told you, motherfucker paying $400 for a fucking inhaler. I was like, oh shit, $400 for an inhaler? Oh hell no.
Trash.
Yeah. The VA really depends on your local facility. It really does. Like mine can't keep doctors.
Yeah. And I've had the same
Every
one
year,
for a while.
yeah. See, dude, every year for the last 10 years, I've had a different physician for my primary care.
Yeah.
Every fucking year.
Yeah.
And so whatever plan the other one started just gets dropped and you start from scratch every fucking year.
Yeah, mine was talking about retiring. I was like, oh, wait a minute. Yo, wait a motherfucking minute. Hey now. You made a promise, nigga. to death do us part, motherfucker. For real. Tom is always promoting the negative. That's not negative. I'm being honest.
He can take care of that, Tom. He's just got to give you the wrong prescription.
Well, all he has to do is give me some Dilantin, because I'm definitely allergic to that shit. Topamax, definitely allergic to that shit. There's another one that I'm just like, it's terrible. I can't remember what it is. I got a list of like 15 to 16 different medications I can't take.
Yeah.
Oh, sickly ass.
No, I'm not sickly. My body hates it.
Sickly.
So what do you think about it?
What do I think about the medications?
Seems like I'm the only person to answer.
Oh, go ahead. Me? The healthcare system to me.
And what you ask? I'm trying to figure out why we leave the conversation.
The reason why I'm neutral on it is because I haven't been to the civilian side since I was 18 or 17, actually. You know what I'm saying? I've only dealt with it. Hold on. No, those are dentists. I've only dealt with dentists. Other than that, I never went to the hospital. After being an adult. After being an adult, I'd never been to the hospital. A civilian hospital. It's all been military or VA. Even in Afghanistan, it was still military. So I don't know. All I can say is from what I hear, it's trash. My mom and dad says it's racist, so I can't argue their points for them, but that's what they say. And I can't say they're wrong or right about it because I haven't had that experience. If they said, hey, you need to lose some weight, I kind of figured it's because I was a fat motherfucker and I needed to lose some motherfucking weight. There's nothing that I can say that I've ever dealt with that was purely racism inside the medical system. So I'm going to say I'm 50-50 on it. Do I like the healthcare where I'm at? Absolutely. But it's a hit and miss here in Florida. I just happen to have a good doctor that I've been with for 8 years. The one before that, I didn't like him because he was telling me to lose some weight. I was fat and he was fat. So, you know what I'm saying? You gonna tell me to lose some weight, fat motherfucker? You weigh the same weight. You weigh the same. Well, I was a big motherfucker. I was like 345, nigga. But he was a big motherfucker too. He was around the same goddamn weight. Matter of fact, his name was Dr. Biggs. He was fat. I was fat. But he would send me to people that I guess he can't speak for how other doctors treat you. So I've had a whole bunch of Usamabads or whatever the fuck they are, Indians. I'm not Usamabads, the motherfucking Indian motherfuckers who just fucking either don't like me or they don't know. They don't. It's not they don't like me. They hate my wife.
They don't like Americans, period.
Yeah.
From my
so I said that either
my dealings
or because the other new was a Usamabaad or Indian motherfucker too that I didn't like. The motherfucker, the first one I talked to about my neurologist, I cussed his pussy ass out. Oh, he's Puerto Rican? Well, shit, he looked. Yeah, okay, I'll cuss out a Puerto Rican.
Oh, that's acceptable. You ain't gonna worry about that.
He got over that. Johnny Babs, LA, been shot twice. You know he loves it. Well, I don't know that because he could have had bad fucking doctors, nurses, whatever that inside there, outside of him being shot. So,
no, I was blessed. The doctor who saved my life the first time, she was actually the head doctor for trauma in Pennsylvania. She wrote a bunch of books. So And then the other one, same thing. But I had shitty doctors before, but I didn't think it was anything besides them just being shitty doctors. And I just moved on to the next.
So you don't necessarily bring it on the healthcare.
No, any field you're just gonna have shitty people. I mean, it is what it is.
What do you think about the cost of medicine or Medicare?
That's crazy. That's well because I used to work in a hospital like you did. I worked in children's hospital, so I've seen it. I mean, charging $30 for a band-aid, like that kind of shit is outrageous. But they allow it to happen. They don't talk about that. They don't talk about that cost that make those things go up. They don't talk about how much these companies price gouge these hospitals and shit. So,
well, what I found is that it's acceptable in the medical field to price gouge. That's the only place that I can say in the United States that I see, besides the cable companies, is the price gouging that comes with fucking medical treatment is out fucking outrageous and outlandish. Like I've seen how much influenza shots actually cost. Like 3 cents, motherfucker, if that. But you're gonna get charged $1,500. Or your so-called insurance is gonna get charged $1,500. It's crazy.
And that's what makes it trash.
Mm-hmm.
Mm-hmm. I ain't never had problems with service. I mean, dislocations, surgery on ligaments.
Mm-hmm.
Shit, I'm running and walking now, so I love my doctors. But I'm not going to sit here and say that my experience is everybody else's. And what I do see out here, like LA said, just sticking to the work that they do. I mean, it's good, but it's still trash.
Well, they say
everybody's not acceptable to get the people that me and LA got. That's the problem with it.
Yeah. Oh shit. They do say that the United States is above majority of all of the fucking countries out there when it comes to medical care. Did you know that doctors here in America take the longest to be trained?
Yeah, but that's also a problem.
That's the major problem. That's the reason why shit costs the most.
Oh, and if you look into the system they use, right, it's antiquated. If you want these people to make good decisions, why do you make them work 24-hour shifts with little sleep?
I don't know, because they do the same thing with nurses, and you're right. That's bad. It's horrible. And
dude, they do the same thing with helicopter medevac crews.
Yeah, it's
ridiculous.
Because think about how much sleep that you miss out in life. I mean, just for a day. I used to work 16 hours straight, and that was fine. When I got to that 17th hour and I'm going home, I'm damn near passing out driving, just because my body's trying to shut itself down and get ready for sleep. But just getting there is just like you working 16-hour days, and that's cool while you're young. I mean, I've done it. I don't mind doing it. I would do it now if I had to. I would do it now if it was a necessity. But thank God I don't have to, because those days far behind me, goddamn it, because I did it for like goddamn shit. It felt like 20 years straight of fucking 16-hour straight days, or 17-hour straight days, 18. This shit is.
What's wrong with it?
What's wrong with it? Yeah. Nigga, you tired of the motherfucker.
Uh-huh.
Tired, especially if you even a sit down job or a monitoring job that you have to stay up for 20 hours with minimum breaks, because when you're in the medical field, your breaks are minimal, maybe 3 or 4 minutes while you're walking up and down the hallway. Shit. I don't know, man. That shit crazy. I don't know. What did you think when you were working in the medical field, LA?
It's a grift. A lot of it's a grift. Yeah, because a lot of these departments who order these things, a lot of times they I don't know, they over order. They don't need it. A lot of things is just for them personally. Like, it's not really regulated like it should be. I think a lot of the cost is just bullshit. And then I I do agree with you with the long hours because they don't care. They don't care about you. And I think I don't know. I really want to know the average lifespan of somebody who actually work in those fields. How long they live after they retire? Because I know with cops, it's like 2 days. They die. They dead after that.
He said 2 days.
Yeah, they're like 2 days, man.
What
But
up,
I'm just
John and
curious
Baptist?
because that's the king. Good. It's not good for you.
Yeah, and we all know decision making capability
Yeah.
declines with lack of sleep.
Yes. Well, motor skills decline after
Yep.
after 14 hours. Motor skills start to decline. After 16, you're damn near putting yourself at risk, and we ain't gonna talk after that.
And these are life changing or ending decisions.
Yeah.
Saving or ending decisions that you're making under these. You know, I can see for a rotation in the emergency room for the pressure aspect of it, but for the rest of it, no need at all.
I think the turnover. So what I found out is that, well, not found out, but this is what my experience with everything is that the turnover ratio was terrible because motherfuckers work long hours and they end up making bad decisions. And I think that's what the hospitals use to keep their numbers in check or on target. Because a lot of people get fired for the decisions they make after working those long hours. There's only a couple of people in any hospital that I would say that stay past 10 years in one hospital.
Oh yeah, unless they move
calling it
into
quits.
management.
Yeah, without calling it
You know,
quits.
yeah.
So let me ask you, John and Babs, what do you think about the medical system or healthcare system? First off, billing and or the treatment of the how you've been treated in the medical field or dealing with the medical field.
In my 30s, I had a great doctor, but he got tired of the
Dr. Kevorkian.
nah. Nah, I had a great doctor in my 30s, but he got tired of the BS that was going on with the regulations that they go through to keep doctors see patients, how many patients they see per hour. I mean, in an hour. So he left the system, but I haven't had a good doctor since then. But the billing part, and I also say that the medical field is what you make of it too. So because my wife is a nurse, I've learned over years, don't just take what they say, ask a bunch of questions.
Oh,
if you don't ask questions, they give you the worst treatment in the world if you don't push back on them. Sad to say that, but it is what it is. And then the last part about the billing, since my wife is a nurse, I love the billing. Charge what they want to charge.
But even when she does billing, she ain't getting a piece of that goddamn money like that.
Oh no, she's doing very well, sir. She made $36,000 a year. We good.
What I'm saying is she doesn't get a big portion like the medical insurance companies do of shit.
Well, and they've caught them, right? Well, they'll take 20% of procedures.
You talking about upcharging, upcoding?
Yeah, and just say, oh, it's not covered, and send the letter out for people to pay it. And most of them just pay it, even though it is supposed to be covered. Yeah, they do this shit on purpose, and they've been caught doing it time and time again. Especially with the the approved doctors list and all that shit with the insurance.
Yeah, well,
if you have an emergency, you can't wait to make a appointment with your approved doctor.
Especially in emergency. Emergency is where I draw the line. That's why I think they draw a line at that. But that even the emergency care is being used right now to funnel money. Motherfuckers don't know it like that, but that's what that's what these I'm gonna take it.
That's why the illegals are using it as primary care.
Yeah, majority of all these states use it because that's a way to get funding back to them from the federal government, is to make healthcare through the emergencies rooms, so they can say, oh, they're not eligible for Medicaid, Medicare, whatever the fuck you want to call it. I don't care. whatever the M word is for it, healthcare that these illegal immigrants get. Plus, motherfuckers who just don't have money, they get paid through that too. So that's how they get paid back through the federal government. So that's how someone in Oklahoma could be paying the taxes of California.
Yeah.
So.
Oh yeah, and that's why they charge you $30 for an aspirin to make up for the cost that they also lose in people who don't pay.
I couldn't find my video that explained that shit, and it was a good fucking video, but I looked at it like a month and a half ago, and I couldn't find it. And I was looking for it all day today. How it explains the motherfucking not even co-pays, but why the regular fucking citizen is, besides just greed per se, because we know these motherfucking not insurance companies, these fucking pharmacies are greedy as fuck. But it's a reason why all this shit is expensive. It's because you may pay your bill, but you're also paying the bill of 6, 7, 8, 9, 10 motherfuckers over there too. Just at a low portion. That's why your taxes for everything else are going to be high, and that's why if Obamacare and all these Obamacare was supposed to be a reform from the 60s. So Obamacare was a reform the healthcare system since Medicaid and Medicare was enacted.
Hey, do y'all see hospitals as businesses?
Yes, absolutely a business. That's why they call it.
Oh, sorry, man. Go ahead.
I mean, that's why they call their clients customers, sir. I wasn't even allowed to call them patients. I was supposed to call them customers. Dead ass serious, dog.
I like the two things that y'all called out. I just wonder why. It's just the way that you guys said it. Like y'all can't believe it. Like that's business, bro. I mean, if you got to subsidize you got to subsidize everything that you lose to get a profit. There's nobody in this world who doesn't subsidize a loss, takes the loss, and still have a profit. So two things that you said was,
but most businesses can choose to have somebody as a customer.
Yeah, they got medical Hippocratic oath. Yeah, they got a Hippocratic oath that they got to motherfucking treat everyone.
You know, if you have a low credit score, a car lot doesn't have to deal with you.
They got to do with anything.
He's making an analogy to that they can turn away.
I'm talking about that. I'm not talking about the people that they turn away. If they turned away business, they wouldn't be a business. So I asked the question beforehand. Do you think hospitals are businesses? You say yes. So again, I'm talking about the part where we just got through explaining that they make people pay for things that's way cheaper for them just to get an increased price so they can pay the people that's working. Just like you guys were just sitting here saying that instead of having people rotate in, they'd rather have somebody working 24 hours where they make bad decisions just to get rid of them niggas, but you pay them a whole lot of money. So is it more to pay one person over that limit of time, or is it cheaper to pay two people?
It's cheaper to pay one person. Overtime is the cheapest form of labor because it doesn't cost more on the benefits side. Like to hire two people, you would be paying two benefits packages, right?
Yeah.
Overtime, you're just paying time and a half usually.
Yeah, but the whole thing about hiring one person and dealing with the stuff that the one person causes is not like the one person gratifies you or guarantees you a whole lot of money when you already know the subsequence from that is them working long hours and fucking up. So then you get other things that go into that. You, again, your practices and everything else, they lose a lot, but then you lose too.
But then it becomes a math problem, OG.
But it's not a math problem, sir.
It is a math problem.
We're not talking about math. We're having a conversation. I'm only talking about what you guys
and it's
up.
About money. And the conversation we're having is about money, right?
Is the conversation you're talking about money? Yes, sir.
You talked about the cost between hiring one person or two, right?
I was literally telling you guys this is what you said. I haven't even gave my opinion on it yet, sir. All right. So again, nigga, you talking about money. I haven't even gave my opinion on it. I said these are the things that you guys have said. Am I right or am I wrong? And then you guys not bring that up.
Oh, I
have
brought it
not
up.
been talking, bro.
I brought it up because it's
But
important
when
factor.
Tom brought that shit up, one thing that you didn't do was say that shit to Tom. Because I ain't the one that brought it up. I was speaking to his point so he can elaborate on it, and maybe you two guys can have that conversation. Not me and you, because I wasn't talking about the money situation. I asked Tom, would it be cheaper? And you gave an answer to it.
What was it? Say the question because I didn't hear it.
Never mind, bro.
No. I was trying to find the video, so that's why I said I didn't hear the whole question. Besides,
Would it be cheap? Would it be cheap? Would it be cheaper to have two people or to pay somebody overtime?
Oh, I did hear that question. Okay, I did hear that question.
You over this bullshit again.
It depends. It depends.
We already got the answer, bro. You ain't even got to answer, bro. And we don't ain't nobody gonna argue about the shit. So I wasn't trying to argue about it. I was just asking the question because it's something that you brought up. I thought was a good point.
Well, I mean, I'm thinking about it right now.
Brought up again was the stuff that they make them pay for that they get for cheap. You literally said that a shot that they can get for $1.75 that they charge people $1,500 for.
Well, it's 3 cents, but yeah.
I thought you said $1.75. I thought that's what you said, like $1.75. I was like, okay, well, damn, that's a whole lot of margin for $1,000-something.
So the valve itself is less than $5. The valve of that, and inside that valve could be 10 to 15 shots, maybe 20, depending on who you trying to give it to. But they will charge you $1,500 for that shot. But something they paid $5 for. Yeah. But to answer your question, I don't give a fuck. I'm going to answer anyway. I think it would be more of a detriment to. Is it cheaper to pay overtime? Yes, in the grand scheme of things, would be cheaper to pay overtime than to hire another person. But it just depends on what level that person that you're hiring on. So if you hire on someone that is in their senior level of fucking whatever it is, it's for sure gonna cost you more to hire that person on. If you're getting someone fresh out of fucking college, out of somewhere else, of course it's gonna be cheaper. So it depends on what level of seniority or fucking career path they're in, on how much it costs, whether it's cheaper or not. So that's the reason why we try to hire us at Space Center, try to hire people fresh out of college, because they're in their beginning stages of logistics and they're supposed to be moldable, but they're fucking not. They quit really quick. They have no work ethic. I don't understand why. But I mean, it just depends. Let's see what the chat says.
Because they're y'all generation. That's why.
No, they're not my generation. If they're coming out of fucking college right now, they're not my generation, smart guy.
Oh, they're your kids. I forgot they're your kids. raised by your generation.
No, they were raised by yours, but it's okay.
No, sir. No, sir.
I guess you did. Your generation did not raise the millennials, sir.
Sir,
your generation, which is Generation X, would have raised this Generation Z, sir. Stop
millennials.
No, you wouldn't. How could you raise a millennial when you're fucking 2 years older than me? You motherfucking moron.
Sir, I raised millennials, sir. I got 2 millennials now.
You a lie. Anywho, your kids. Well, how old is your son?
No, my son's not. My son is barely. He's on the line of borderline millennial or the next generation. My daughter's most definitely the one after millennials.
I know. I ain't stupid. So what do you think Mayo is saying? Kingdom Minded. I mean, I hear both sides. It just depends. It's a money aspect in everything you do, because not only do it cost motherfuckers to pay the person or pay overtime, you get that upcharge and every damn thing, but I put most of that on greed of motherfuckers. So greed of
and I say it turns into a math problem, because you remember Fight Club? Everybody here remember Fight Club? Yeah. When he explained how they do the math on if they're going to do a recall or not based on the amount of lawsuits, the probable amount of lawsuits that are going to come out of it.
Oh, you're talking
about the amount of lawsuits is less than it would cost to do the recall, they don't do it.
Oh, damn. I didn't pay attention to that movie because I remember that.
I'll see if I can find it on YouTube, a clip on YouTube, because it really explains liability.
Okay.
which is what all businesses are concerned with nowadays.
Mama said, remember hospitals and some clinics are owned by corporations. Yeah, that's true. That's true. The hospital that I started working for in the 90s is now owned by a corporation. Not 90s. Well, it was late 90s. Yeah. Oh, yeah, 90s. Yeah, it was late 90s. So yeah, it's now the hospital is now a corporation that does nothing but mental health, which corporation doing mental health is something different. But yeah.
Yeah, I found that clip. I'll put it in the back, Tom.
He said they price fix. I would say they tried. I ain't gonna say price match. That's a fucking lie. They don't price match. It depends on if you're with a group or not. So if you're in group medical do try to fix prices or price match, or you got to pay like $10 over. Like I played that one video where dude says the pharmacist said he gets it at the cost of what it would cost plus $10. So if the medicine was $5, he will buy that medicine for $5. Well, you'll get the medicine for $5 plus 10, so you'll be paying 15 for it just for him getting it. But the government gonna pay $3,500 for that shit. That's how that shit works.
And Tom, right? The Defense Department also usually pays the cheapest for medical supplies because they buy in such bulk.
Yeah, well, they don't. Yeah, you talking about the
DOD. When DOD buys, they buy in bulk.
Yeah, they buy in bulk also because they're actually. Oh my god, it's a weird one because they do a lot of humanitarian missions too with the shit. And that's what pisses me off because not only do they treat the soldiers, they also treat other people that are not Americans as well.
Oh yeah. Dude, I'm not arguing that, right? But DOD can extend their meds.
Yes.
Past their expiration date. Civilian medical can't do that.
And
they need to be able to.
They do. They can. It just depends on what it is and where what temp it was at. And it depends on a lot of factors because it goes through stages of it. Because I have to fucking do it all the time. Even now, even with fucking glue, mail, I have to send out for someone to come check and see if it's still viable and all this stuff. But they do the same thing in medicine. Is it worth it to have someone come out and look at the shit and make sure it's okay? Or
no, it's cheaper to just throw it away. That's the problem.
Yeah, so that's
like everything medical has an expiration date, right?
Yes.
Whether it's made out of gold or it's made out of fucking tissue paper.
Mm-hmm.
And they have to follow that expiration date, which is bullshit. It should be condition based.
Yeah, I agree with that because a lot of medicine is not as good past this date because no one actually knows when it actually breaks down to its molecules unless you run tests on it, and those tests have to be thorough, and those tests are never done. Those tests are never done.
You know what the standard for those tests is? It has to be 1/10 of 1% less effective, and then it becomes expired, which is insane.
Yeah, I didn't know what it was. I don't know. I didn't know the breakdown of it, even though I had to learn it. I don't remember that shit. I ain't gonna lie. I got a brain injury.
So we're using a movie for our answer?
No, he just wanted.
That's an example of how liability limits are set and how they control decisions that companies make.
Use the movie for an example.
Well, it's called. You want to know what it's called? John Baptist. Or
I heard him. I heard when Mayo said it earlier, but you can say it again if you want to.
What did he say earlier?
I don't know what he said, but I heard him say it earlier. That's if I remember. You actually did I
I used a popular culture reference to explain liability.
So
and how companies make decisions. Like in the medical field, this would be what's the cost of a medical mistake versus what we're going to save in labor costs.
It's not just labor costs; it's all costs around. Yeah. It's a little more than that, but yeah. I mean, I get the reference of what he's trying to say. But it's a lot more factors than just A, B, and C. I wish it was that easy. I wish it was that easy. It's never that motherfucking easy, especially for recall. Because that's my area of expertise. I have a lot of recalls every day that I have to literally search through 1,000 goddamn items to make sure it wasn't made by that company. Believe me, it's an exhausting fucking process. Exhausting. Don't be in quality control. Or quality control is not that bad. Don't be in GuideEps. That shit is terrible.
Yeah.
GuideEps is terrible. Because that is what governs fucking recalling of any product, any item, down to the solder that it was used. Down to the fucking solder. And if y'all know everything that is fucking dealing with electronics has solder in it. So yeah. Because one of the major chip factories here, or chip factories in the world, they kept sending out faulty fucking soldered goddamn chips to us. Yeah. Man, guess who had to do the recall on that shit? Yeah, it was awesome. And some of those shits is about that fucking big, and you gotta count all those shits. That shit sucks. But let's get into the nitty. Well, let's start off with some people and their complaints. Let's do that. We'll start off with complaints first, and then we'll go into the rest of the shit. So here's a little bit what we were talking about there, John the Baptist.
So I don't normally jump on that health insurance is a scam, but today it is absolutely a scam, and I swear it's fraud. I need an MRI on my back because I hurt my back. My clinic sent it over to a hospital. They ran it through my insurance. They called me and said, hey, your portion of it that you're going to have to pay after insurance is $5,100 for this MRI. So I'm like, wow, okay. I was like, before we do that, like, just wait, because I'm like, $5,100 just seems wild. I called another place who was also waiting for my insurance to go through to see how much it was going to be. My insurance was still on hold with them, but I asked them, hey, if I just cash pay this, how much is it going to cost for this MRI? And they're like, well, if you just want to cash pay it, not run anything through insurance, it's $700. And so I'm like, sounds a lot better than $5,100. So I called the original hospital back and said, hey, if I don't run this through insurance, what is the cost if I just decide to self-pay it, since I know the other place is $700? The lady's like, I'll rerun it under you being self-pay and I'll call you back with your total. So a few minutes go by, the lady calls me back and she goes, hey, I talked to my supervisor. Since you have insurance, we are not going to let you self-pay it, so we won't give you that number. How is that not a scam? Isn't it my choice if I want to self-pay something versus running it through my insurance? How I should get to decide that, not you, but they're
That's a typical scam. I would call that a fucking scam.
Oh yeah.
When
they did the ACA, Tom.
Oh yeah.
It tripled the size of doctors' staff just to deal with it.
For the first year and a half, I want to say, because it kept, first off, the shit was trash when it rolled out. It was trash in the beginning way, but yeah, it was terrible. That's why they were needing what they call billing encoders, or in billing encoders they had they were mass hiring for that position with no motherfucking experience. I think like 7 people I knew got a job just doing billing, encoding, billing encoder. I was like, oh wow.
And that's literally just finding the code.
Yeah.
For the issue.
I don't think I'm not making an excuse for it. I just think, a motherfucker should have the option to pay out of pocket if they want to, if they choose to. Especially if it's gonna be fucking cheaper. If it's gonna be, I'm not paying $5,100 when I can get it done for $7. That shit right there just don't make sense. I mean, it's cool and all for them, but that's just showing us that, and we can't say that's just built into it. All this shit is fucking ran by motherfuckers' greed and pockets. That's one thing I can agree with Beans on, is that medical care, healthcare, and health insurance and all this shit is a scam, bro. It's a fucking racket. But what are you gonna do with it? What are you gonna do besides either live with it or shit, live without it? I'll be back on my after my background. Okay, this nigga still riding bikes. Yeah, that shit crazy. Shit. I don't think it's an excuse though, but I mean, excuse could be the truth at the same time. United Health. This was another one chick. I want to hear this because I didn't listen to this one. That last one was actually proves the scamming of goddamn insurance companies because that's the reason why the VA asked me, do I have any other health insurance? I say no all the time. Oh, hell no. Because they would tell me, well, you need to go through you need to make sure you use that one too. So we can all, I'm like, I don't use that shit. Do I have
they
it?
want to bill your other healthcare insurance.
Yeah. What's this TRICARE? And I'm like, nah, nah, I don't do none of that shit. I only stick, all my shit stays with the VA. Uncle Tom, where did John the Baptist go? John the Baptist said he had to go ride his bike, and he'll be back after he ride his bike. But I actually have something for John the Baptist because it's me and my whole got to show John the Baptist shit because I like showing John the Baptist shit. Anyway, let's hear this chick show story time.
So United Healthcare is evil as fuck. We all know that. And today's episode comes courtesy of...
Isn't the CEO the one that got popped?
Yes, sir.
Ah, okay. Yeah. Well, it is what it is.
Of them sending me a $550 bill from Mount Sinai saying that they didn't cover any of the services that I got despite being covered by UHC. Now, because I'm familiar with United Healthcare chicanery, I made sure to call them before I went to this appointment and ask them, is this going to be covered? Is this going to be covered? And I was told, yes, it is.
That's true. I don't know about in her case, but even I do the same thing with TRICARE before my wife. Even with TRICARE, we have to call TRICARE to make sure everything is approved. Because I ain't trying to get no $700 bill, no $800 bill. I get tired of paying the fucking copays, to be honest with you. Well, I don't pay him. She pays them. Because I don't use the motherfucker. But if you don't, first off, they'll deny you. Right now, TRICARE is not looked at as a good insurance company because actually they use Humana on me. I don't know why why TRICARE is frowned upon between hospitals and insurances and all that, even though it's a government ran entity. You can't get shit from CVS. A lot of these mom and pops pharmacies, they don't take TRICARE no more. So it's terrible how it's frowned upon, but it's government insurance. Like they say, if y'all want the government to do Medicare, Medicare for all or Medicaid for all, whatever they call it, shit, health insurance for all. Good luck when these pharmacies and doctors stop taking that shit, and then it's gonna be forced into motherfuckers working for them motherfuckers, just like they're doing pretty much now, where they maintain how many doctors can be doctors, how many residencies are available for doctors to take it. I mean, to be able to come do their residency so they can become a doctor. That's it's a fucking rabbit hole. It is a fucking rabbit hole. And
well, because they have to hire at least one person, if not two or three, just to manage the TRICARE system on their end.
Yeah, I know, but
it's not worth it. Well, the profit they're going to make is not worth the cost of the people to administer the program from their end. That's why they don't take it.
But that's fucked up. You know why? Because they take Humana, and I pay Humana, whatever the fuck. What is it called? Ain't it Humana? Humana, whatever the fuck this. What'd you say? Humana. Okay, whatever the fuck that shit. Whatever that shit is called. Yeah, that shit's terrible because simple fact is I need to go to CVS sometimes. Sometimes Walgreens don't got it. But I do like my other pharmacist friend, since he's a fucking pharmacist and he does compounding. but they stopped taking his fucking TRICARE fucked up, right? No, but why did they stop taking TRICARE? You don't know? Oh, she don't want to talk to me.
It winds up costing too much to administer. That's why they
It's
stopped.
probably something like that. I don't know, man. This shit sucks because if we didn't say TRICARE, we just said Humana, they'll take that shit. It's crazy. It's crazy, stupid. But let this he, she, they, thy tell her story.
Because they are in network and you only have a $50 copay. Okay? That's what I was told. So I'm like, are you sure this is a network and I will only have a $50 copay? They're like, yes. I even had the conversation with the woman at Mount Sinai and said, can you make sure to check my benefits before I come in to make sure that this is covered and it'll only be a $50 copayment. I had put off this appointment that I was supposed to have at like the end of February until mid-April to ensure that it'd be covered by the insurance, okay? So I go to the appointment, I pay the $50 copayment, they say all is set, everything, and then all of a sudden I just get this bill for over $500. I call United Healthcare and I said, you told me that this was covered, that I had a $50 copayment for a specialist. She goes, oh, well, we meant it's $50 for a specialist for a consultation. You had other services at this appointment. You had an EKG, so those are the add-ons. Excuse me? What do you mean add-ons? This isn't a buffet. We have a card that says that it's a $50 copayment for specialist visits. This is the kind of thuggery that is happening at insurance companies and especially United Healthcare. United Healthcare, their whole thing is fucking over patients. Like, that's their whole shtick. They should make it their fucking slogan. United Healthcare, how can we fuck you over today? You guys understand what an insane scam this is? What an insane illegal racket this is? So they tell you one thing, yes, this is gonna be covered. It says it on your card, specialist, $50. And then she tells me, oh no, we're not covering any of that because you had other services at the appointment. The appointment we said was going to be covered. Yeah, that's why I went to the appointment, to receive care and services from a doctor. And you told me that was going to be covered, and now you're saying, oh, actually, I know we said it was going to be covered, but we didn't realize that you were actually going to do anything at the appointment. We didn't realize you were actually going to talk to a doctor at the appointment or have anything done at the appointment, and those things actually aren't covered. When we said in-network and covered, we meant you in the waiting room. Once you actually go to see the doctor, well, then we do whatever the fuck we want. But we won't tell you that at the time. We'll wait 2 months and then send you a surprise bill. This is mafia shit. Now, I know United Healthcare is really busy getting sued right now for, I guess, providing too much care, which LOL, considering the fact that you guys deny more claims than any other company, and that you were recently outed for paying off nursing homes to reduce transfers. I don't know how you guys aren't all in jail, okay? I don't even I do know how, because this country's corrupt as fuck and our politicians are paid off by you. You think this is an accident or an oversight? Why would they change when their whole business model is denying people care to make shareholders money? If you haven't put 2 and 2 together yet, this is also how they transfer wealth from working people to the top 1% in corporations. And in this case, how they accomplish it is they charge us monthly to have insurance, and then when we go to use the care, they deny it and give that money to shareholders. So do you see how this scam works?
No.
We pay monthly for the insurance, and then they bill us a second time when we try to use the insurance that we've paid for so that they can take our money again to give to shareholders. This is a joke. This is a joke. I'm not paying this bill. This is a ransom. This is a mafia racket. You don't get to tell me on the phone that this is covered before I go and then turn around and go, oh, did we say covered? We lied. Let's get this into the national conversation. Share in the comments your experience with United Healthcare and how they fucked you over. And if this video happens to get to someone at United Healthcare, I would like for you to know you don't have a right to steal from me, which is exactly what this bill is. It is an attempted robbery with a claim number.
I mean, you ain't got to pay it. No one told you you had to pay it, motherfucker.
And Tom, be honest, right? Say you go to the specialist, right? And they find out you need to get sent into an operating room immediately.
That's different. I would say that's different.
But guess what? That specialist doesn't have to do an EKG either, right? Unless you meet a certain criteria. They don't know until the visit.
Yeah, that's true. There's some
because
things
and the problem is the healthcare consumer doesn't understand this shit.
Stop with the insurance payer. There you go, OG's demons in the that nigga's on demon time. Yeah, I agree. I'm not gonna listen, man. I found out how much people pay for insurance at work. And I said, ooh.
Dude, it's crazy now, dude. Ever since the ACA, this shit is crazy.
Hold on, OG. OG. What shit? OG listening. I said, ooh. They pay every check.
Yep.
$475. And that's on the low end. $475 a paycheck. Now, mind you, they don't make that much money. Well, it's not they don't make that much. They do make a good, decent amount. But it's nowhere near what I'm getting paid. And I'm like, nigga, if you take $475, I'll be complaining to my wife. I'm like, man, I'm tired of paying this goddamn vision and dental if you motherfuckers ain't using it.
Well, but that's how they're funding the ACA coverage through the system.
Yeah, man.
Right?
That's crazy.
Your plan, if it covered just you, under the ACA,
it'll be a lot more.
Has to include gynecological care. Yeah. Do you have a vagina, Tom?
It depends. Sometimes I gotta get that dust out of my pussy. Sometimes I'll be acting like a bitch. Sometimes I ain't gonna lie.
You don't have a vagina that needs medical care, right?
No, not medical care.
So why do you have to have that care in your plan for yourself?
I don't know.
You're paying for it for somebody else. That's what it is.
Yeah, because I also get asked, do I have I been pregnant before? Like for real? Like nigga, like what? What? But goddamn, listen, when they told me $475, that's a whole paycheck for some people. $475 for medical? Come on, man. If that ain't a fucking racket, I don't know what I thought it was supposed to be affordable health care.
It is affordable, sir.
To who?
It is affordable.
To who?
To the people that benefit from it.
I don't even complain about paying my little $47 a month. I said, shit, and that's a month. Not every paycheck. That's a month. $47 for these. Well, my wife and the other jigaboo to go to the hospital. I don't even use it. I'm on there, but I don't even use it. F the system, save up and spend wisely. 2025. What man is pregnant? Nigga, take a blindsided hit play. Listen. They ask some of the dumbest questions, man. I know another question I hate, Mayo.
What, sir?
Are you thinking about committing suicide today? Like, bitch, I'm not even here for that. That's one thing I get tired of hearing. Like, come on, man. You make a motherfucker want to commit suicide coming in here answering these dumb ass questions. Have you thought about committing? No.
Oh, yeah.
Do you feel like hurting someone else or yourself or others? Yes, nigga. Every time I get on the motherfucking goddamn interstate, every time I go to Orlando, I feel like killing 1,000 people. Running if I had a motherfucking super truck, I'm running all that shit over. Because them motherfuckers are my nerves.
And Tom, if you ever answer yes to any of those questions, you get in a 3-day lockup, sir, in the Baker Act.
Well, it depends. Like if you're saying jokingly, yeah, they'll be all right. Now, they do ask. Are you serious? Because I've been asked that. Matter of fact, when I cussed out my motherfucking neurologist, they was gonna lock my ass up. They had the goddamn security come at the VA.
Oh yeah.
Yo, that shit is crazy. You don't act up in the hospital, dog, because they'll show enough lock your ass up. They don't play at hospitals no more. But yeah, even what she said, I understand what she's trying to say or what she's meaning, but it just hers just doesn't make that much sense to me because you said you had other shit outside of that. Now, if you said that you were going in to get an EKG and all this other shit, that's a different thing. Like, I know if I make an appointment to go get an EKG or EEG or whatever they ask me to go, I have to make that appointment to make that get that shit done. I just don't go to a fucking consultation to talk to the hospital, talk to the doctor, and then say, you know what, I'm gonna give you EEG right now, unless there's something absolutely wrong with me right then and there. Yeah. And then it's be something different. So I understand what she's trying to say, but what she say happened, she kind of lied. So, it is what it is. But you don't have, my whole point in that, you don't have to pay the motherfucker. You ain't gotta pay it. Let that bitch set up for 7 years and then it'll fall off. Don't worry about it.
Well, no, but I think it doesn't even go on your credit report anymore.
Matter of fact,
healthcare doesn't even go on your credit report anymore.
No, they do. It still does. It just goes in a different area, I think. Let's ask Gemini. Let's ask Gemini. Does medical debt go on your credit report?
Medical debt can appear on your credit report, but only if it goes to collections. Current rules offer protection. Paid medical collections are removed. Unpaid medical collections under $500 are not reported. Unpaid medical debt will not appear until it has been in collections for 1 year. Would you like to know how to dispute an incorrect medical debt on your credit report?
No, I'm an expert at that, bitch. I got a whole bunch of them hoes taken off. I'm an expert at that shit. Hey, if y'all need help with y'all fucking credit report, let me know. I'll charge you $50. We'll get it all off.
And all you got to do to keep it out of collection, sir, is to pay $1 on it.
That's all. Every month. Yo, listen. I had so much medical debt on my shit that was like $75, $175. And I said, I ain't paying that shit. Fuck that shit. Nigga, I ain't paying that shit. I ain't putting $1 towards it. And then one day, the Lord blessed me when I was watching this infomercial at nighttime. If you need help with credit repair, I was like, oh man, fuck that shit. So I bought a book just for it. I read it. I put the words to paper, typed that bitch out, and I sent about a good 200 letters. Not even 200, but a good 60 letters out in the mail. Sent them bitches out. Boom, 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 boom. Waited them 30 days, nigga. I ain't hear no response, nigga. There was no response on none of this shit. Oh, okay. Oh, I looked at my credit report, nigga. I went from like a 460, nigga, to what was it, like a 720, nigga. Damn dog. 30 days later, I was like, hell yeah. Like they literally took off shit about 30, I say 20, 30 different things on my fucking credit report. Because most of my shit was on there for years, right?
Yeah.
So, because I used to be like one of them niggas like, this nigga just add a motherfucking staple. Bitch, I don't care. Fuck that shit. I ain't paying that shit. That was me. I ain't like that no more. I ain't like that no more. That was the past me. I've been born again. Let's see. I don't got no more complaint ones. What is this? That's the okay. So this is the 1996 or this motherfucker Bob Menendez who went to jail. I think he went to jail, right? He's still in jail, right?
Yeah, sure.
This nigga, he was a co-sponsor of the 1996. That's how long that motherfucker was in Congress. 1996, co-sponsor of the doctor shortage shit.
Have a great healthcare system without great doctors.
New Jersey lawmakers sounded the alarm. The state will need an estimated 2,800 more doctors by next year just to meet demand, but they probably won't come from Jersey. One reason, hospitals like Holy Name and Teaneck can't offer enough openings for residents to complete their training here. A 22-year-old federal law caps the hospital's graduate medical education program at just 6 doctors, the same number Holy Name had when the law was passed.
It makes no sense.
Think about that shit, Mayo. The government is regulating on how many doctors can become doctors. Now, you got some classes that have like 30, 40 motherfucking doctors in there. Well, soon to be doctors. They have to stop what they doing after they finish graduating shit. Hopefully they can get a residency that they got to be there from 3 to 7 years. 3 to 7 years as a resident.
Yeah.
Just
working like a slave.
Oh, that's crazy work. This is, I mean, if this ain't, that's a racket right there. Because if think about how all these motherfuckers was able to become doctors, right? How the prices would go down because there's so many of them. It won't be this. Now they're competing for customers. They'll have to compete for customers. At least that's the way I'm thinking in my brain.
Oh, yeah. Yeah.
So if they have to compete for customers, that drives the price down on services. At least that's the way I look at it. You got more in the market. That means motherfuckers got to compete for those same people. That includes insurance is going to have to look. Guess what they're going to have to do? They're going to have to find a doctor that want to go with their bullshit ass prices.
Oh, yeah. What? And if you cost a doctor too much, or you cost an insurance company too much as a doctor, they'll just drop you off network.
There you have it. What up, KP?
What's up? That's just like your homeowner's insurance. Yep, same thing.
Mm-hmm.
Yeah. But just think about that. The government regulates how many fucking doctors there can be every year. That's fucking crazy. I didn't even know that.
I didn't know that, bro.
I didn't even know that until last month. And I was like, wow, and I fucking should have kept that fucking video, Mayo. But I fucking didn't because I'm a dumbass.
And they probably did it based off of how many doctors they had on staff to keep an eye on those interns, right?
Yeah.
Or a supposed safety aspect.
Mm-hmm.
So it literally makes sense for them to have the least amount of doctors.
Well, it just lets them be able to market cap.
Yeah, it does. It caps the market, and they monopolize it. Yeah, damn, I never knew that.
Mm-hmm.
1996 is not 2019. These caps have failed to keep pace with the growing demand for a larger physician workforce.
If you want to keep growing as a state and as a nation, we need to bolster our medical pipeline by expanding physician training programs.
Worse, Jersey's doctors are aging out. 35% of them are at least 60 years old and headed for retirement. That's the nation's third highest percentage.
Oh, motherfuckers.
As the healthcare system faces an impending spike in baby boomers who'll need more doctors. Companion bills sponsored by Senator Bob Menendez and Congressman Bill Pascrell and Josh Gottheimer would update those caps for all hospitals nationwide and encourage residency programs.
Statistics show that if someone does the residency at a particular hospital, they are more likely to stay in that community. So they go to medical school, they graduate out, they have to go to residency, right? And then they often stay in the community, right? And that's and are able to treat our families and of course help our economy.
Jersey's got 5 medical schools, so there's no shortage of medical graduates here. But without more local residency openings, they leave. Holy Name wants to restart its residency program with a focus on primary and palliative care. The hospital would open 100 positions for new medical residents, but it can't, while it's frozen at the original 6 slots.
And part of the inequity in the system is if we didn't have any, if we had
6
zero
slots?
in 1990,
Yes, sir.
we wouldn't be having this discussion because the rules say then I am unencumbered, I could start and I could have 100 residents tomorrow.
Hey, can you pause it right there?
Legislation
Yes, sir.
stalled last.
To have 6 slots and to know that Americans are actually living longer than they used to is crazy work.
Yeah, well, see, there's laws that were put in place for that shit, which I think it's just weird.
You know what? It's crazy because I went to the doc Monday and hadn't been in a while, and I went Monday and I asked him about about a family history issue, right? That my father had. And he said, you may want to check with your insurance if they cover that or not, because that's not documented that they will cover that. I said, okay, I'll get back with you. And then he also told me, because I'm not 45 yet, I asked him about colonoscopy, right?
Yeah. Well,
And
don't forget, once you hit 45, you got to get that goddamn that finger in the booty hole.
yeah. I know. So that's what it's about. So So I asked him about it early, right? Because I'll be 42 this year, November, in this month. So he said, if you want to do it now, they're gonna charge you because you're not 45.
Yeah. It's a regulatory thing that all 45-year-olds get it.
Yeah.
It's like for women to go through menopause. It's
And the
something that
mammograms, yeah.
yeah.
So I was
Yeah.
like, damn. I said, what if I'm considered high risk? He said they would still have to approve it in order for you to get it. And if you were to force us to do it now, they could charge you up to $15,000 to do it. I said,
Yeah,
shit.
just to stick their finger in your asshole, nigga.
Yeah, that's not for 15K, cuz.
And then got that big knuckle and shit.
Yo,
Yo, that shit be crazy. I said, yeah, because my doctor asked me about it. Like, yeah, you 43. You can do it. Again, I go to the VA. You can get it done if you want to. I was like, no. I'm not in a rush to let you stick your finger in my asshole. That shit nasty, dog. Look, this woman said, I want to be there.
Sir, you go to
you.
VA, sir, you're getting the camera, not the finger.
Oh, yeah, that's true. Yeah, that's true.
That's
gonna
true.
put you
Right.
under.
I should have went to the service. Damn. Yo, so
Give me that
but they
CBD
did.
juice.
But Tom and Mayo, my cousin did tell me, who works in the hospital, that they do now have these kits that they send you home with.
Yeah. The
It's
stool
not,
kits.
Yeah, it's not the same, but it still detects though. She said so.
Yeah. Well, what my doctor said is not as accurate as them doing what they have to do to get it done. And it only
that's
takes,
what I figured.
it only takes like 5 minutes for them to do it. They say, go in there and look around, break it out, and you're done. It's just a 5-minute motherfucking job.
Yeah, they'll send that shit home. It's called Cologuard.
Yeah.
They'll send that shit to you in the mail and just have you send it to the lab.
Yep. But I listen, I'm not in a rush to let anyone stick their finger in my ass. So I listen, I ain't gonna lie. When I had that first Q-tip, in the head of that, oh God, dog it. I about died. Nigga. I don't know.
I felt some type of way when I see he's like 95. My father-in-law's father. He was in there. He had the catheter. I said, "Damn, boy, I know he hurt." I said, "Oh, dog."
You know how many motherfucker those I put down? Some old motherfucker. Oh, dog, that shit terrible. Listen. Let me go.
Mm-hmm.
I can't do it. I just know I'm not walking around with no goddamn catheter down my. Dog, that shit is terrible.
Take me to a nice cliff with a nice view.
Nigga, where's that guy?
Listen, I had the 22 to the back of the head, and I'm good.
That damn big ass Q-tip and down your penis and shit sucks too. Oh my God, might pick up cancer cell in the poo. If it does, you still gonna have the scope. Yeah, which is 6 feet long.
Mm-hmm.
Mama, shut your ass.
But if it doesn't, guess what? You've avoided the camera for a year.
That camera's a bitch, boy.
Mm-hmm.
Oh, come on, bro.
You think that finger feels big?
Hey, man, that motherfucker got some big ass knuckles. I said, nah, dog, we good, man.
That would be crazy. Some big ass motherfucker. It's always some big old dude with some big ass hands. Man, get the hell out of here, bro.
Nah, we ain't doing that shit. I'm sorry. I'm at work still too, so don't worry about me. I just got a fucking Teams call. Like, dude, I don't know what the fuck you're talking.
Hey, boy, they be trying to have a team. They be trying to have the teams popping all day, don't they, bro? Hey, sometimes I be looking at the teams thing like, man, if you don't cut this shit off and get off of this shit.
Oh, I don't know. I have hold on one second. God damn it, man. No, all my shit fucked up. I don't know what the fuck I just did, but I did something. Oh fuck. Shit. All right, there we go.
Oh no. Yeah, I remember, oh, you can keep your doctor. Your health care is going to be cheaper. All them ACA promises.
Yeah, them ACA promises was lies, and everybody that didn't have it is essentially became a tax on it. It became a tax. It became an additional tax for people that didn't have insurance.
Oh, it's still additional tax. I mean, everything costs money. That's a problem. And motherfuckers who think about who says they don't understand what it is, it's always gonna be a tax. I don't give a fuck. Taxes is theft because I didn't choose to pay for these motherfuckers. I didn't choose that shit, so I shouldn't be charged with paying for these motherfuckers to be degenerates. Hey, I understand people don't want to pay for. Here it come. What the hell your name is, nigga? John the Baptist. When I see how much that motherfucking money is for that goddamn shit, dog, nigga said $475. Bitch, kill yourself. I'm not paying that. I'm not paying for you. Oh, you better get your ass, get up here and work like I'm slaving like a motherfucker. All right, so here's what y'all was just saying.
This promise to the American people: if you like your doctor, you will be able to keep your doctor. Period. If you like your health care plan, you'll be able to keep your health care plan. Period.
We weren't as clear as.
Period. I need that period, bitch.
That's how he got all the sisters to vote. He's like, period. Like, yeah, that might be where they got it from. Obama.
He the reason why I lost my doctor. He is the very reason why I lost my doctor.
Okay.
We needed to be in terms of the changes that were taking place. And I am sorry that they are finding themselves in this situation based on assurances they got from me.
Yes, sir.
It's very easy for a politician to stand up before voters and say healthcare is a right.
Oh, do you take
and then
accountability for this?
passionately advocate for single payer or free healthcare or Medicare for all, whatever term they might use.
No, he just said sorry.
But before we
and fuck
consider
you.
the merits of the
that's
accountability.
Well, what is he supposed to do besides saying I'm sorry? That's the only thing he can say.
Fix it with legislation, sir.
He can't. He's not in office anymore, though. But at least, hold on.
That's when he was still in office.
Yeah, it was when he was still in office.
Okay, but at least he did own up that he made a mistake. I mean, that he did something wrong.
Man, his apologies ain't worth a damn from them cats, bro.
No,
dude. Costs too much money.
I'm going to say this though, for him to at least own up that he did something wrong. We can feel safe in blaming him.
Yeah, he can own up to it now that he ain't got to get elected again, and he retires on a fucking government salary.
Yeah, he got a salary and everything. He got a cushy Secret Service all the rest of his life. His daughter's paid for, wife's paid for. Hell, if he ain't
I'm an asshole. If I was a president, I'd take that shit away like he did the rest of the motherfuckers. He took Kamala Harris's shit. I'm taking that president shit too. They took Trump, so why can't he take his? Shit. Taking that nigga shit too. Fuck that nigga. Excuses again. Ain't no one making no excuses. Let's go.
Government managing your health care, and that's what this all boils down to. Maybe we should ask a more basic question. What do we mean by health care? Because if you get sick, and here we're talking major illness or you're in serious pain, you don't just want health care, you want quality health care. And where's your best chance of finding that? The answer is right here in America. For skilled doctors, cutting-edge medical treatments, and care without long delays, no other country rivals the United States. Not even close. Nobody from Texas is going to Canada for medical treatment. It's almost always the other way around. Sure, our healthcare system has lots of issues, and we should address them. But do we really want to upend all the advantages that we do have and start from scratch? Because that's what would have to happen if we completely turn healthcare over to the government. So let's imagine we make the change. We hear a lot about how great free healthcare would be, but it's only fair we look at the downside. The first is that government-run healthcare takes medical decisions away from patients, that means you, and puts them in the hands of bureaucrats. They decide, for example, how many MRI machines are going to be available, or under what conditions you can get back surgery or a bypass,
Right, you
or
pause
even
it
whether
right
you
there.
qualify for cancer treatment. That's how it works in the United Kingdom under its single-payer system.
Go ahead.
Like people act like, like people act like the culture that we live in, and they don't see things from the many media sources that we get, like movies, right? Anybody that likes like movies, they seen John Q. They seen how that went, right?
Oh yeah, I
Like,
remember John Q, but I don't remember shit about it, to be honest with you.
well, John Q he had insurance, but the insurance still didn't cover, what he needed done. So these people have this bright idea
His son
that
need a heart transplant.
yeah, he needed a heart transplant. But these people have the bright idea that they're going to turn everything over to the government, and then they're going to trust the government to tell them that it's okay for you to get this surgery or that surgery. At the same time, when they'll tell you in the next breath, they don't trust the government. People are insane, bro.
Again, I always say the people that say they don't trust the government the most believe in NASA, which is a government entity. But it is what it is. What it is. Yeah, I'm not disagreeing with you on anything you said there. Go ahead, John.
Oh no, I wasn't saying. I was just helping over with the movie reference he was making.
Oh, yeah. I don't remember a lot of movies, to be honest with you. I got a brain injury, so I don't remember all that. Really? So
Yeah,
throw
because
everything
it
out.
basically depicted that, like, he had I think at the time, if you guys remember, it was a lot of HMO plans at the time, and now it's kind of like PPO most of the time. Now it's like PPO and then a tier above that and stuff like that now. But he had a different plan and it didn't cover this and it doesn't cover that. But like, people don't realize that they don't like the government in their business for all these other things, and then now they invite them in after they hear all these talking points from these politicians that they believe is coming to save them, when they
But you
know
talking
damn
about
well.
you talking about two different types of people though. There's certain
Yeah,
people who don't want the government in their business, and that would be the true liberal, the true diehard liberals who want less government. And I'm not talking about modern day liberals. I'm saying true diehard liberals. Then you got the people who are food stamps and welfare who want the government in their business. That's two different class of people you're talking about.
yeah, it is two
But
different.
they're also the ones saying that you can't trust the government.
Yeah, but they're saying that at the same time, Mayo. Yeah, they're saying that.
Mhm.
But I don't care. But I don't care what they say, because what they say don't match up with what they're doing. So what they say is irrelevant.
Yeah, you're right. That is irrelevant because they're gonna trust them to hit their snap benefits.
Give them their food, their wealth, their housing, their welfare, the money in their pocket. They trust the government for everything. Yet they don't want them in their business. So what you're saying is irrelevant to me.
Well, yeah, because when you allow the government to feed you, you also allow them to stop feeding you.
Yeah, they can starve the hell out you. Yeah.
The one thing I would give my mom a lot of credit for is that she would not get on food stamps. Well, she got on food stamps for her, but she would not get on welfare and government housing. She refused to do it because the one thing she would always say is, I want them around my business.
So OG says, really? So throw everything out and start new? Stop the cap. That he didn't say. The person in the video said we don't want to throw everything out and start new. So I was gonna go there. He did say that.
And from what I understand, the Canadians have some seriously long lines at the doctor based on their healthcare system.
I think it's more. The UK is more than Canada.
Whew,
to be
I don't
honest
want
with
it. I don't want it.
Don't Canada have boards determining if they're gonna give you the surgery or not?
I think that's entirely of the European Union, if you ask me, but I don't know.
Yeah, Canada has boards too.
Yeah.
And as long as you're a viable citizen, you can get treatment. If you're no longer viable, i.e., above 55, you get in the bare basics.
He said above 55. Damn, Mayo, not viable no more.
Mayo, you out. I'm still in. Let's go.
Yes, sir. Not for long though. No, sir. No, you remember I got that VA cheat code.
That's a fact. A fact.
You need to get that VAT
Because it has
code
finite
too, Tom.
resources, the National Health Service, or NHS, sharply restricts access to treatments like hip and knee replacements, cataract surgery, and even prescription drugs to deal with common conditions like arthritis and diabetes. If you suffer from any of these ailments and many others in the UK, you may just have to live with the pain. And let's hope you don't have a medical emergency. In a January 2018 article in the New York Times, patients in emergency rooms around London are described as having to wait 12 hours before they are tended to. Corridors are jammed.
Sir, that's in America too. Let's start the bullshit. Hey, I don't know. Let me
finally
with beds carrying the frail and elderly.
What do you say?
Finally, somebody said something.
Oh yeah, that's bullshit. Cause that's in America too, nigga. I
He
waited
was
7
bullshitting
hours.
about the other way. He was talking about bullshitting about the other side too. We couldn't even have this type of system. Our system is too strong. We got not just hospitals. We have institutions that set up properly for every motherfucking body. So it doesn't matter about what the motherfucking government think they gonna use, whatever they're gonna use, nigga. We already set up for everything. Down there, every corner you go to, if it ain't a hospital on that bitch or block, you can go around the corner, find a clinic. They got the same bullshit they got, and they might charge you more, but they got it.
Yeah, I don't think he was speaking. I don't think he was speaking.
I know about the small bill for the nigga. I'm just saying the nigga.
I wasn't Smallville for. I said all I was gonna say is I don't think he was speaking for America's system. I think he was speaking on.
I know he wasn't. I was.
Oh, okay. I got
because we were just talking about how the shitty the system was, right? Most of this stuff that he was just explaining, if you go back 3 seconds, if you put the diabetes and all that shit on there, ain't that what they said these motherfuckers on food stamps had?
Yeah.
Ain't these the motherfuckers online talking about they need to get rid of because we believe that, you know what I'm saying, people who don't get it, we better than them. They just using the government, they using our money. This is what I've been told from the internet streets, especially YouTube world.
Absolutely, man. Get them motherfuckers up off my money, dog, out of my pocket. You over here Smallville for these niggas.
You hit him with the Malcolm X. Get your hand out my pocket.
Shit, I want these motherfuckers out of my pocket. Nigga, I just looked at how much motherfucking boy, thank God I am what is it called? I am what the fuck homesteading. And I got that good old 100%. I ain't got to pay these goddamn taxes, nigga. That nigga just showed me how much my house tax was gonna be from fucking November to March, nigga. I said, oh, Jesus.
If they passed that bill in Florida, y'all have to pay house taxes?
No, not yet. But I don't have to pay because I'm 100% disabled.
The moment they passed that, I'm probably moving to Florida.
Man, listen. This niggas, let me tell you how much the bill they said. They said, do not pay this. This is not for you to pay. I said, thank God. $6,398 from November to March. Bitch, kill yourself.
I don't know why people want medical go through the government anyway. They're Obamacare and the government assisted for healthcare. To me, I think it's just a scam. It's just the way we started food stamps back. What was it? If I say the wrong president name, we started in the 30s when they started this. The government plan to give everybody Social Security, retirement, Social Security. Was it Lyndon B. Johnson?
Yeah.
The Great Society programs.
There you go. That was I don't think that was intended to be forever. But then now we can't give them up under it.
Well, here's the motto. It's easy to give it to someone. It's extremely hard to take it away.
Correct.
So if they ever say, hey, we're gonna give you this shit and it actually is implemented, don't expect them to take it away. You're just going to have to add another $1 trillion to the deficit because they will never stop paying for this shit.
Yeah, this is why I'm saying, and which why I say we need to find another way. You're not going to be able to take affordable health care away now because people they got used to it. Even though you pay way more.
Take it away. Just reform this shit again. Obamacare was a failure from its inception.
Oh no, it wasn't. It was incredibly successful for its purpose. which was to end healthcare as we have it in America and usher in a single payer system.
Yes, but
It was designed to implode the system.
Okay, that's cool and all, but I'm telling you, from what it was said to happen, to start off, you can keep your doctor. Didn't happen. You can keep your medical insurance if your medical whatever premiums or whatever the fuck that was, and it didn't happen. It was supposed to lower the premiums. It skyrocketed the premiums. The premium's still going up. To this day, they're still going up. For something that was supposed to lower the healthcare costs, it did nothing but raise them. So yes, I can agree with you on what you're saying there, Mayo. But the talking points for the motherfuckers here in America was it's supposed to be this, that, there, and this shit, and it didn't do that. And they're still trying to literally force people to have this shit. But it's okay. Let's finish out this nigga.
To deal with the situation, hospitals were ordered to postpone non-urgent surgeries until the end of the month. That hardly seems like an improvement over what we have in the US. A second big problem with single-payer systems is that they are expensive, really expensive. A recent study by the Mercatus Center at George Mason University found that a Bernie Sanders-style Medicare for all health system would cost a tidy $32.6 trillion over 10 years. That's on top of what the federal government spends on healthcare today. And this is not a new number. Other studies have found the cost to be roughly in the same range. So, how would we pay for it? Kenneth Thorpe, a professor at Emory University and health policy official in the Clinton administration, spells it out. If you are going to go in this direction, Medicare for all, the tax increases are going to be enormous. Not just for the rich, Thorpe estimates, but for working Americans and the poor too. Charles Blauhaus, the author of the Mercatus study, puts it this way. Even a doubling of all projected individual and corporate income taxes would be insufficient to finance these added federal costs. And he considers that a conservative estimate. Canada knows all about exploding healthcare costs. In Ontario, the country's biggest province, those costs took up 46% of its entire budget in 2010.
Damn.
By 2030, that number is projected to be 80%. In other words, in a few years, Ontario will have little money to pay for anything except healthcare. Finally, and perhaps most importantly, government-run systems depress the search for new cures. Biomedical research spending in the U.S. far outpaces that of any country with nationalized healthcare, even when you account for differences in population or size of economies. That's one reason medical breakthroughs rarely come from countries where the government controls healthcare. They come from the United States, where the government doesn't. The lion's share of biomedical research and development spending in the U.S., over $70 billion in 2012, comes from the private sector. Discovering new medical cures and technology is a profitable business, and thank goodness it is. Those profits drive innovation. Take away the profits, and you will surely take away the innovation. Single payer, free healthcare, Medicare for all, they might sound great, but like all visions of utopia, they ultimately produce a lot more harm than good. I'm Lan Hee Chen, fellow at the Hoover Institution at Stanford for Prager University.
I disagree with some of the shit he says. I disagree with some of it. And for the most part, it's what I've heard from other places too. So that's nothing he said right there was new news. The whole thing about Canada shit was crazy. 80% by 2030. I don't believe that. Shit, that's a lot of. Well, yeah, I don't fucking know. What do I know?
If you're just a regular person, Tom, and they discover your cancer at stage 2, you're going to be at stage 4 before you can start treatment.
Oh, absolutely. I believe that. I believe that.
Wow, look at this.
But Khan Shawnee said their medical care is the best. That's what Khan said. That's why he ain't said shit yet.
Everything going well with your diet?
Yes, ma'am. Richard Rueda suffers from diabetes and belongs to Alameda Alliance for Health, a public not-for-profit health plan for low-income residents in Alameda County, California.
This was before Obamacare. Just let y'all know.
What is he about?
He says if he
What is he, mid-30s?
That nigga's about 360, dog.
What about mid-30s, early 30s,
He's
mid-30s?
probably in his early 40s. He look
That's
old
too.
in the face.
I can't see that. Okay.
But then they got that saggy ass belly. That's terrible. And he's diabetic.
And is he even a citizen?
Yes, he's a citizen of
It's California, sir. It's
That's why I
California.
said. That's why I said citizen of California.
Look at his shirt. He's a citizen.
Look at his shoes, nigga.
A member, his life
They
would be
mismatched,
much
nigga.
different.
Think I probably wouldn't be here right now. I'd probably be in bed crying my eyes out. I mean, I'm doing the best I can with all that they've given
American.
me, and I feel privileged to be part of it.
There are about 2 million members of consumer-owned healthcare cooperatives in the U.S., where organizations own healthcare facilities and employ doctors. Other types of co-ops purchase health insurance together. The Alameda Alliance could be called a hybrid, containing elements of both co-op, public, and private options.
What the fuck is we doing?
That's some diabetes shoes, man. And them diabetes socks.
They about to cut that nigga whole leg off. God damn, son.
He's still eating them tacos and burritos, man.
Oh man, I ain't even watched this video. I should have watched this all the way through. I said, them was socks, nigga. I thought those were two mismatched shoes, nigga. God dang.
Experts say this kind of a mix may be the best bet for national health care reform.
We need to take the best of what American medicine offers today, coverage, the kinds of benefits, the kinds of technologies out there, but also think about those gaps.
There are questions whether co-ops can compete with giant private insurers and whether co-ops actually cut costs.
Even if tomorrow I had my magic wand and every American would have health insurance coverage, that doesn't mean that the bills or the price tag would go away.
Rueda says he's no policy expert, but knows compromise is needed to make sure all Americans get the same level of health care he receives.
I'd like to see the doctors, the clinic, and the insurance companies all try to link together better.
The president says he prefers a public plan, but co-ops may have more bipartisan support. Obama says he wants to sign a health care reform bill by the end of the year.
Oh, he did.
Thank you so much, doctor.
Haven Daily, The Associated Press.
Didn't was it Michelle Obama that wanted to change school diets?
Yes.
And take over. You know what? I kind of wish she would have succeeded at that.
She did.
Did she?
Yes.
Yeah, sir. The kids just threw the food out because it was so shitty. They didn't eat.
Yeah. I wish they would go one step further, because this like, if you're on food stamps and welfare and free lunch, they should control what diet you're going to eat. They should make it healthy.
They did. I'm telling you, they did.
No, I'm saying even at home, like with the foods you can buy, because this is what's happening. You cost us money for food stamps and welfare, then you cost us money for health care coverage. You cost us more money. So at some point you have to start. If they're gonna come to you, they're gonna treat you like daddy government. And at some point you gotta start being daddy then. They start telling them what time they can eat, what they can't eat, and what time they got what diet they got to be on. If you're gonna pay their mortgage, if you're gonna pay their rent, their lights, their food, their medical care, then you need to start being daddy to them and train them as kids as you should be doing as a daddy.
Yeah, that's why I always say food stamps should be commodities, not money.
I mean, good luck on that. I mean, that sound good. I mean, that really do sound good.
But it was that way until 83, Tom.
Again, there's a lot of people that wasn't getting medical care in 83 too.
No, I'm just talking about food stamps.
Oh, okay. I don't
just talking about it needs to be commodity based, not money based.
Oh, okay, yeah. But when motherfuckers getting the government cheese and shit, right?
Yes, sir.
Okay, yeah. I remember my mom and dad had a block of government cheese every now and again.
That milk powder, that peanut butter that broke the bread.
Yeah.
Big block of cheese.
I ain't gonna hold you. I loved MREs back then. I don't know what I loved MREs. When my dad brought home MREs, I would fuck them shits up.
They do try to watch what they eat when they give them that WIC. You know what I'm saying? As far as
WIC is literally for something geared for something else, as they say, which would be the importance of The mother and the baby, so they say.
But Tom, isn't SNAP? Remember, it's supposed to be the supplemental nutritional assistance program. It's not supposed to be by the primary food.
They don't know what supplement means, sir.
I know.
It means the government.
Birthday cake.
That means the government
12
and
liters of
motherfucking
soda.
citizens don't know what supplement means. It's okay. I mean, we already know that we're kind of the dumbest motherfuckers. That way ain't the dumbest, but there are some dumb motherfuckers here. But we're close to it. You know what I'm saying? We're close to the bottom, dog. Anyway, I found this one kind of fascinating for the little bit I did listen to. It's a good listen. We'll break it. We can stop. Just let me know when to stop it when you want to hear something. When you want me to stop it.
Welcome to another edition of Lumberjack Logic. I'm your host, Neil Johnson, and I've got my special guest today with me, running for governor of Minnesota. So Scott Jensen, Dr. Scott Jensen. And I'm really excited about this interview because years ago, I actually had health insurance that I bought on my own because I've always been independent contractor.
Say it again.
I thought he was talking to a woman in the gray.
Oh, wow.
And it was reasonable. I mean, it was still $400, $500 a month, somewhere in there, but it was reasonable. I mean, it was still a lot of money, whatever, you know, you're giving up $5,000 a year. But then Obamacare came in and my insurance went up to over $20,000 a year, over $25,000 a year. And it got to a point where it just didn't make sense to carry health insurance because your deductibles were increasing, as were your premiums. And it all happened under the quote-unquote Affordable Care Act. And remember, folks, if you like the content, remember to subscribe to the channel. But I really want to ask you about...
So we back on the money part, OG. He said he was paying $5,000 a month, then it jumped to $20,000 to $25,000 a year. I'm sorry, not a month, but a year. That's a lot of fucking money.
That's a 5-time increase.
Ain't no way I'm paying that much money for fucking
and your deductibles went from $500 to $5,000.
That's crazy. But all right, back on this money.
The healthcare industry as a whole, because you are a private practitioner. Now, this is rare today. Okay, we had a private practitioner, Dr. Woost, who was up on the North Metro when we moved up there. Because my wife had an emergency C-section with my daughter Rebecca, who's running the camera. And the surgeon told her she would never have a natural childbirth again. That was it. It was over. And she found a private practitioner who said that's not necessarily the case. My wife had actually researched this out a lot, and there was actually more. If you were healthy and you had recovered well from this, there was more of a risk of having a cesarean section. So by the numbers. And so she found a doctor who agreed with her, and he was willing, and we've had now 4 more children, all have come naturally. So the medical industry has become a big kerfuffle, I think, through HMOs and also through insurance. And I don't think the answer is more government in insurance or more government in medicine, but less government in medicine. And so I want to get your take on what you think would be good healthcare policy. I showed you that graph earlier, but it shows the growth, just so you folks know, it shows the growth of administration. I'll put this graph right in there, but the growth of administration, the growth of physicians, and the spending per capita.
All right, so physicians are pretty flat. Administrators, goddamn, ooh-wee. And then the percentage of growth of U.S. healthcare spending per capita. That shit just, ooh, wow, that's horrible.
It looks like the same chart with education administrators versus teachers.
Yeah,
So they said that's what they spent per person. Is that what they're saying?
Well, spending per, I would say that's household. I would say that would be household.
Okay.
Because that's pretty much how they do the fucking medical insurances anyway, was through with a household. Unless you're a single person.
This is money. This is amount of people doing each job.
Yeah.
Oh, okay.
Except for the spending part.
Yeah, well, I'm saying the last line. That's what I'm asking. The last line, is that for you said it's per. You think it's per household.
Yeah, this line right here is I would say it's per household. How much they're spending per household has increased since 1970 to 2009. Now, when it goes to the physicians, their costs haven't increased that much. And then we'll see administrators. They're all the way up through the roof and shit. So it is what it is. These motherfuckers go. But hey, that's interesting. I would like to see a more recent chart, to be honest with you. Let me see if I can find out. Let me see if I can Google this shit. Well, can you show me the growth of physicians and administrators in health insurance and healthcare?
Between 1975 and 2010, the number of healthcare administrators grew by 3,200%, significantly outpacing the 150% growth in physicians over the same period. Some sources suggest a current ratio of 10 administrators for every 1 physician in the United States. Would you like to know about the reasons cited for this administrative growth, such as increased regulations or the complexity of the healthcare system?
Sure. Yes.
I put one to 2015 in the back, Tom.
Okay, cool. We can look at that. Bring it up real quick. That's interesting. The growth period of it. Oh, damn! It still look the same.
Yeah. And it keeps going up.
This shit looks this. Matter of fact, it is the same. Even
It
the
just
bump
keeps going up.
That shit. Hold on, let me start this real quick. That shit is damn near the same. Where the fuck did that go? Oh my goodness, that's horrible. Shit share. There it goes. Look at it. It's still the fucking same. That's crazy. God, that's 1987. Oh, I can't see that small ass shit.
Well, I found one to 2020, Tom. Hold on.
Well, this one says the growth of 2018, so this one's better. And
okay, I found one to 2020, Tom.
All right. Wait.
And it shows the law changes and where they came into effect too.
Man, that's crazy. That's maddening, man. It tells you the same thing with teachers, bro. Like you said, it's just teachers and administrators. It's just, dude, when you see these administrators making $350,000 and you got teachers that's making 30, it's crazy. It's insane.
Mm-hmm. Now schools got what, like 3 vice principals?
Yeah.
Teachers bring no value to the society.
Well, neither does administrators.
I know. Don't even want any money.
But they get it though.
Yeah. Because it is keeping to the government.
The janitor is the most important person there.
Okay, so there you go. Ooh, jeez.
They should be. They should
break up all the fights. Yep.
Healthcare spending is still going up, and the physicians is still steady going. It's not that much of an increase. Everything else.
The increase probably goes with the population.
Yeah.
For doctors, but the rest of it's out of control.
Damn.
Because administrators cost money.
And you would think, like, I don't even go to the hospital, bro. Only time I go to the hospital because they tell me I gotta go. I don't make my own appointments to go to that shit.
Administrators people that do the paperwork for insurance and bills and make sure hospitals gets paid right.
And top people. Don't forget.
Yeah. Management.
Yeah.
Management versus labor. Management and office workers versus labor.
Yeah, but I think
overhead.
I think the administrators. I think the most part of probably administrators wouldn't be the top people. I think it'd be more the mid management and the people doing the.
No, sir.
So you think it's the top? It's more of them.
It's more.
You think it's more of them? Wow, that's crazy.
No, not more of them. They get paid more. So the spending is what it's talking about.
Okay.
And the spending of it is growing.
Well, I would see. Okay. So let me. So how does this fit in there? So the people who actually sit around and make sure that the insurance companies are paying and the patients are being taken care of. That's admin too, right?
Yes.
Yes.
Okay.
Yes,
so now, so my question is, if you had way more sick people than you did 60 years ago, I'm not just throwing a number out there. Wouldn't that increase the admin too? I mean, wouldn't that increase those admin because you need more people to cover to make sure their paperwork is getting processed?
Yeah, but weren't computers supposed to fix that differse?
Yeah, but I don't think it's not. I don't think it's doing it, Mayo.
But even that, I don't even think they're not getting paid like the top administrator. Them motherfuckers are billing coders.
No,
Think about
sir.
this. If you think, okay, well, go ahead.
We don't know. Okay, before you say that, where do billing coders get paid?
They ain't getting paid $100,000 a year.
They being, I can tell you what, I know for, I'm not quite sure what the title is called, but I know they're getting close. They're getting close to that.
Let me look it up.
Oh yeah, depending on, and it depends on what level
What's
you
the
are, right?
average pay of a billing encoder?
Put in healthcare
Median annual
in that.
pay for medical records and health information specialists, which includes medical billers and coders, is approximately $50,250. Though this can vary significantly.
That's not a position. That's not a position I'm thinking about. Then
And certifications. Certified professionals often earn more.
Certified professional, so CPAs.
no, I'm not. Okay, so I'm probably thinking about the wrong title because I know the people I know working in the industry make way more than that.
I know.
So I probably,
Those
yeah.
are healthcare administrators.
Yes.
Those are the ones who figure out what's covered and what's not.
Yes. The billing coders, all they do is sit at home and they motherfucking input bill codes to motherfuckers.
Yeah.
Okay, so I'm talking about something different. Then okay, all right, I
Yeah.
got you.
But it don't even matter. The people that are
Yeah.
doing the actual work, which is the goddamn doctors and nurses and CNAs and LPNs and all them motherfuckers, they're still down here. They're down at the bottom.
Yeah.
And they the ones doing the work.
Yeah, everybody else is overhead.
That's it. That's crazy.
All that red is overhead.
Yeah.
Cost.
Whew, cool. Hey, let's go back to this motherfucker. That's insane. It ain't. It looks the same.
It's steady climbing. And it's going to keep that way as long as we keep doing this.
Yeah. All right, let's continue.
So
there's a lot to unpack there, Neil.
I know.
And let me just start at the top. If we look at the whole pie of American healthcare expenditures, we spend 19% of our gross domestic product on healthcare. That's more than double what the typical first world country does. That's more than double what the typical European country does. So we need to break that pie down. What is it? What's driving it? Well, there's hospital costs, that's a big one. Physician clinic costs is another one.
Yeah.
Prescription drugs is another one.
Yeah.
Administration is another one. And then you're going to have your long-term care facilities, and there'll be some miscellaneous thing, durable medical equipment. But if you look at the big ones.
And then prescription drugs, I suppose.
Yep, and I mentioned it, prescription drugs.
Okay.
So if you look, actually the fastest inflating force right now in the healthcare scene is prescription drugs.
Okay,
that's
that's
a
what I
fact.
thought,
Yeah. But if you go to health care, hospitals, we've reduced the use. And in many studies, it indicates that the actual hospital portion of the pie has shrunk slightly. But what hasn't shrunk is the administrative part.
Yeah.
If you look at what's the cost of administration in healthcare from, well, when I graduated from high school, 1973,
Yeah.
it's gone up some 3,000%. You've got the graph to show that. But if you look at the increase in physician costs over the last 50 years, on a relative scale, it's almost flat.
Yeah.
It just creeps along the bottom, while up here is the administrative. And then you put everything together and you get a pretty rapid rise. I think that the idea that government-run healthcare is going to be a solution doesn't make sense. We have some pieces of government-run healthcare in our country, and they don't perform that well. I mean, the Veterans Hospital Program, the Veterans Administration, it isn't like it's...
Well, that was a scandal back during the Obama years.
But it's not really like the creme de la creme. I mean, a lot of my veterans will go to the VA once a year to get their medicines.
Yes.
But otherwise, the rest of the year, they're in my clinic asking me to take care of them. So I don't think government-run healthcare is the answer. On the other hand, we have to remember who are the big stakeholders that are basically trampling on individual patients. And nobody likes to be called out on this, but if you look at our system, big stakeholders are certainly big pharma.
Yes.
Mm-hmm. Another one is the insurance companies. Mm-hmm. I got in a little hot water 4 years ago when I voted one night for a Democrat's amendment on Medicare buy-in. And people said, why would you do that? Are you supporting government-run healthcare? I said, absolutely not. But I'm calling out the insurance companies and telling them they've got a monopoly. And by George, if they want to have my support, they better treat us right. And that night we had learned that the insurance companies weren't going to provide in some 15 counties in Minnesota any options for individuals. So if you were an individual, maybe a one-man show at a car body shop, auto body shop, maybe a photo or whatever.
Yeah.
If you didn't get your insurance through a big company through your employer, and you didn't qualify for medical assistance, then you had one choice, and that was they were driving you to the exchange or go without.
Yeah.
And I said,
I remember
no.
that, Mayo. I
That's
remember
not
that.
right. I said, if you're going to have this monopoly, because at that time we hadn't allowed for profits to come in, you have to provide an opportunity for individuals in every one of the 87 counties. So I voted for an amendment that failed, and within 3 weeks, the insurance companies came out and said, yeah, we can do it, we think. We've got something for everybody, every individual in every county. So I think sometimes we had to push hard. But there's some other big stakeholders in the process too. We've got these huge hospital medical clinic conglomerates. They're forming accountable care organizations. A lot of patients don't realize it, but if you're involved with an accountable care organization and they can hold the expenses down during the course of the year, so that maybe not order an MRI for you with your back pain, then
I'm going through this with my mom
then
right
their
now.
utilization drops, their cost drops, and you might get a bonus payment at the end of the year. If you spend too much money, you might be on the hook and you might have to write a check. So when you join this accountable care organization at the front end, it might sound really cool. But the fact of the matter is, there are some hidden agendas that nobody's telling the patient about. And then let's talk about pharmacy. It seems like every time an expensive drug goes from a trade name expensive drug down to a generic level, all of a sudden, here's another one to take its place. Trade name, expensive, bells and whistles. It really isn't that much more effective, but all of a sudden, it takes the place.
And they can advertise it now.
They advertise it.
Because when did that change? That changed?
That was in the 90s.
In the 90s?
Direct-to-consumer advertising.
Yes.
Yeah.
And so then they're asking you for it, right?
Yeah, the patients come in because they saw the ad. The same statistics that allow a drug company to tell the viewer, if you take this drug, we can reduce your risk of heart attack by 40%. Those same statistics could be used by me, and I could tell you, if you go on this drug, and I do 49 other patients like you on this drug, out of the 50 of you, one person will experience a benefit. Now that's a 2% improvement, not a 40%. But that's what happens with statistics. If you want to mush them around enough, you can get them to say 40% reduction of risk because they're talking about relative risk. If you talk about absolute risk, it's a 2% reduction.
Wow. Well, it's a great conversation on healthcare. I mean, we could dive into this for another couple hours, but folks, Scott Jensen, running for governor of Minnesota, and obviously understands the healthcare industry, and I appreciate your time on that. So thanks so much for listening, and thanks for watching Lumberjack Logic.
Well, I can't complain about that shit. I mean,
Yeah, Tom, look at diabetes drugs, right? Remember when people got the vial and a bag of needles?
Yeah, my mom used to get it. My brother used to get it because he was a juvenile diabetic.
And now they get those pre-measured multi-injection.
All you gotta do is stick them on your arm now. It has enough for I think a week or so or something like that.
What was the cost of the vial and the needles, sir? Pennies compared to these auto injectors and these systems that hook up to your phone.
You want the absolute truth? $1.27.
Yeah, that's what I mean, right?
And the needles, it depends on who you get them from. The needles actually cost more money than the actual medicine does. Motherfuckers fail to realize that the needles cost more than the actual medicine does.
But when you put it in a nice, fancy looking auto injector or a pump system that goes on your arm and gets monitored by your phone, that shit goes up 3,000-4,000% in cost.
Yeah. Well, the good thing about it now is they are covering that for older people now. Like my mom, I know she has it. I think she has it on her arm. I'm not sure, but I know she said. Matter of fact, the damn thing calls me, man. It calls me.
Yeah.
When she's ready.
And I can understand that, Tom, for people that are special needs and for older people. who
Yeah,
may
yeah, yeah.
forget to check their blood sugar.
Oh, absolutely. I think my
But I
brother
can't
got one
see
now, so I
that.
told him to do it too.
Yeah, I can't see that for people in their 20s through their fucking 50s.
Mm-hmm.
Because the cost benefit, isn't there?
Man. Well, you know, they're not gonna do it unless you got some decent insurance. To be honest with you, because it's gonna cost through the roof. So there's that.
Yeah, but that decent insurance is the same insurance that you're being covered by,
Yeah.
that your premiums are going for.
Yeah, yeah, yeah.
So your premiums would be cheaper if they just covered the needles in the vial.
Yeah. Well, innovation is what kills everything, brother.
No, sir. Convenience is what kills everything.
I said it right. I said it right.
I'm Keith Torbath, and thank you for attending this STS Advocacy Conference. Let's talk for a moment about the Resident Physician Shortage Reduction Act. This bill has had a lot of bipartisan support, and in the Senate, it is supported by Chuck Schumer, Robert Menendez, and John Boozman. In the House, Terry Sewell, John Katko.
So this failed. I think this did fail. In the end, it was because they wanted to raise the amount of physicians from the the residency program that they were having, and it still failed. So
Tom Suzy and Rodney Davis. So with that
think it did. I'm
bipartisan
not
support,
sure.
it should be a relatively easy ask to get your representative or senator to also co-sponsor this bill. But why? Why do we need this bill enacted? Well, there are a number of reasons, but let's start with what this bill primarily addresses, and that is graduate medical education. As you may know, GME is largely funded by Medicare, hence the involvement of Congress and the federal government. But it is also funded by Medicaid, private payers, the Veterans Administration, and other state and federal programs. And this investment has long been understood as a benefit to society to have a skilled physician workforce, hence the government subsidization. So, adequate GME funding is essential to training this workforce that would meet the needs of our population. But why is this a problem? Seems like this has been in place for a while, but what has changed is that the population has grown and the number of GME positions and the funding for GME in particular has not grown to match that. And in fact, there's projected to be a shortage of between 54,000 and 140,000 physicians by 2033. And this also includes a shortage of surgeons, between 15 and 30,000 of surgical specialists. In short, this is driven by many factors. There is the aging population and as well the physicians that are aging and retiring. There is this outdated cap on the number of resident positions. This cap was put in place in 1996, and that number has not changed over several decades. And as well, even if there had been some increases in the number of GME positions, there still is a significant maldistribution of specialists that this act would help address. So the important features of this are that there has been an attempt to address this shortage at the UME level, specifically increasing the number of med schools and therefore the number of med school graduates. And that has occurred. There's been a 30% increase since 2003, but there has not been a concomitant increase in the number of GME positions. So
I'm looking at this and I understand it, right? You got a whole bunch of motherfuckers vying for a certain amount of spots in a different residency program, and those residency programs are not getting filled because they don't have a lot of slots because it's governed by the government. So in actuality, the government has a bottleneck, if they want to call it, but yeah, that's the bottleneck of how many physicians can be literally finish their residency, because the residency itself lasts for 3 to 7 years. So it's think about how many motherfuckers go to college. They got to get a 4-year degree first. From that 4-year degree that they get in college, they got to go through a graduate school for another medical school for another 4 years, and then they have the residency. Yeah, well,
At
no,
least 4.
Yeah, at least 4. And then they have the 3 to 7 year residency program that they have to go through. So if you're waiting around for a year, you're pretty much doing research or something stupid to fucking make ends meet, because you're technically a doctor, but you're not a doctor because you haven't finished your residency. And once you finish your residency, you still got to take a test. That shit is crazy for your license. It's insane what you have to do to be a doctor. That's why I said it's not even worth it. I'd much rather go sell drugs. It's quicker.
And that's just another reason people aren't getting into the field anymore.
Yeah.
And the fact that residents are doing 24-hour shifts 7 days a week, 365 days a year, no vacations, nothing. When they could be doing 3 doctors on 8-hour shifts.
Mm-hmm.
Right? So you just tripled the amount of fucking residents that you're training at the same time, just by putting them on 8-hour shifts.
Yeah, absolutely. And you're getting more doctors at the end.
And you're getting less burnout. Yeah, because you're getting less burnout.
Yeah. Hell, fuck 3. Just do fucking 10. 10 of them doing 8-hour shifts. Shit. I don't know how many times I sat in the fucking hospital waiting to be seen for a motherfucker. That shit's annoying. That's why I don't go to hospitals, dog. Hey.
Dude. When I went to the VA for that spider bite, right?
Mm-hmm.
The doc came around with all the residents in the morning, right?
Mm-hmm.
And yep, we'll get your test back and let you know what's going on, right?
Mm-hmm.
You know they don't even do night rotations anymore?
No, they don't. They just have one come in the morning. Overnight is just goddamn the nurses. The nurses do everything overnight. They may have one doctor rotating through the whole resident, but motherfuckers in that are actually in the actual hospital staying overnight.
Yeah, but you're not going to actually find out anything until the next morning.
So the most I've seen, because I'm always in the old people side, that's what they put me at, because I'm a what do you call a fall risk. I'm a fall risk. I see, so I have all these fucking bands on and shit. That's why I don't like going. Oh, yeah. I'm with the old motherfuckers who dude over here shitting on himself because he. That's why I hate going to hospitals. I hate staying in them. You can ask my wife. I will not, if I don't have to stay. Listen, if you forcing me to stay, I'll stay. Other than that, I'm going home. I'm going fucking home.
Oh yeah, I'm even signing myself out.
Oh God, it's just
outside
terrible.
of medical. Because if I'm just waiting for test results, I ain't gonna sit in the hospital and wait for fucking test results. I can do that at home.
Yeah, man, and that's usually what I'm happening for me. Is like the random test. Why'd you have a seizure? Bitch, I don't know, man. My fucking brain had a hiccup. Bitch, I don't know. The fuck, I don't care no more. Oh man, that's why I said fuck it. When I had this seizure on the football field, I was just like, well, fuck it. It is what it is. I passed out. I didn't. That nigga hit me out. I ain't going to the hospital for that shit. I can feel my fingers, my toes, and everything else. I'm good. If my wife would have been there, she probably would have made my ass go to the hospital. I don't know. Maybe. Probably not. Because she know I hate him. She knows I hate him. What a passion. I'm like the worst patient ever. I really am.
Well, that, and honestly, with your seizures, Tom, the biggest problem is secondary injury during the seizure than the seizure itself.
Well, no, I think the worst thing for me would be fear of stroke. They actually have, because most people that have seizures have a more likelihood to have a stroke or a heart attack. So that's what they're scared about. Because I did have one where I couldn't feel my whole left side for a good shit. A good 5-10 minutes. I couldn't even walk, bro. Just everything. I couldn't feel shit.
But in that situation, it would make sense to go to a hospital, right?
I was at the hospital when it happened. I was going home. It was after an MRI. I think it was MRI. It was a scan of some sort. It was long. It was in my brain. And I was like, I feel weird. I kept telling the chick I feel weird. And when I say I feel weird, I really feel weird. Yeah. And I'm like, you know what? I'm just gonna go sit in my car and wait for that shit to stop or whatever. Because I was supposed to have someone with me, but she was at home with the kid and she had to go pick the kid up. simple life shit happen, right?
Oh
So
yeah, I lied to. I always say I got to ride home when I jump in, and drive myself home.
Yeah, man. I'm just sitting. I'm like, man, it was like my whole left side just drooped down and my legs stopped working. I'm sitting there dialing the wife, and I'm like, I just can't feel. I just can't feel my fucking body. It was crazy. That's some crazy shit. And it was called something, but
Like
I
a
don't know.
TIA.
Yeah, that's what it's called. TIA. Yeah,
Yeah.
that's what it's called. Yeah, that shit was crazy. I ain't never had no shit like that before, but it is what it is. All right, let's continue with this motherfucker.
Need this act to be instituted and made into law to allow this expansion of residency training to match the expansion that we've seen in undergraduate medical education. So there have been some recent events that have been heartening because this type of physician reduction act has been in place, or has been proposed, I should say, since 2007 on basically an annual basis. Why is the ask important now? Well, we've had a little bit of a breakthrough with regard to Medicare supported GME positions. In December of 2020, Congress increased this number for the first time in 25 years, and they added 1,000 positions. Now that's 1,000 positions spread over several years, and they're very, very specialized as to who is able to obtain these positions, what institutions
This
are
is maddening.
likely to be able to get an increase in the number of GME positions that they have. But this still, nevertheless, was groundbreaking in that there had been no increases in GME positions, as mentioned, for several decades. So this particular act then builds on this and would increase the Medicare supported GME positions by 14,000 over 7 years. Again, won't solve the overall projected shortage of physicians, but it certainly will help, and therefore is important for us to take the opportunity now to get this act converted into law. So specifically, what's in this bill? As mentioned, 14,000 new Medicare supported residency positions over 7 years. It sets criteria for allocating new GME positions, again, something that probably has needed to be addressed over time. And it requires the new GME positions be funded in line with current Medicare reimbursement levels, allows the qualifying hospitals to receive up to 75 new GME positions per year over this 7-year period, and does require the Government Accountability Office to conduct a study on increasing the health professional workforce diversity. So this is important for a number of reasons. CMS is required to consider the likelihood of a hospital filling that position and must divide at least 10% of the slots to each of the following categories.
This is how stupid it is. I just asked Gemini, how many doctors graduate from medical school annually? It's in the tens of thousands, Mayo. Annually graduate from medical school. Of that, you only get maybe 2,000 residency slots available.
Same with lawyers.
That's crazy. So what at that point, what would be the point of going to medical school? It don't make it appealing. As a matter of fact, let me see.
A lot of them go to practice in foreign countries.
Residency slots are available annually in the United States of America for doctors?
The most reliable source for residency slot availability is the National Resident Matching Program, NRMP, Maine Residency Match. For the most recent data from the 2025 Maine Residency Match, a record number of slots were available. Total certified positions offered, 43,237. This includes all postgraduate year positions. PGY1, PGY2.
These are people already in the positions.
PGY1, positions offered, 40,041. This is the critical figure for new medical school graduates starting their residency training. This number represents a continuous increase, setting a new record for the number of residency positions available in the United States. Key residency match statistics. 2025. Category. Number of positions. Total certified positions. 43,237. First year, PGY1, positions, 40,041. PGY1 positions filled, post-match, and SOAP. Approximately 39,890, 99.6% fill rate. The number of PGY1 positions filled is calculated based on the 99.4% fill rate for all positions after the Supplemental Offer and Acceptance Program, SOAP. Would you be interested in seeing a
Oh, no. That don't even make any sense. That don't make sense.
And see, Tom, I can see why this bill didn't pass. Because Medicare would have to pay for it all.
Yeah. Okay. Yeah, because that doesn't make sense.
14,000 new Medicare-supported residency positions over 7 years.
Yeah, that's why I'm saying this shit's not making any sense. But it's okay. Let's continue.
Hospitals in rural areas, hospitals training over their GME cap, hospitals in states with new medical schools or branch campuses, hospitals that serve areas as designated professional shortages, and it also requires hospitals to increase the number of residents' full-time equivalent positions by the number of slots awarded. This is important as it prevents a hospital from swapping a slot that is not supported by Medicare with one that is. So all of these are critical pieces of the bill that, while sound somewhat limiting, the bottom line is it will.
So I think what he's talking about that are unsupported, right? Well, the supported ones are just medical residency slots that are being paid for by Medicare. If I'm not mistaken, I don't know. It's just confusing the shit out of me.
And I look, Tom, this did not pass, but it's been
brought up every year.
Every year.
Yeah.
And it's got a total of one co-sponsor.
Yeah. And that would be Bill, whatever the motherfucker went to jail. Menendez. I think it's Bill Menendez, whatever the fuck his name. Bob Menendez. Yeah. That's crazy. That's crazy. All right.
Increase the number of positions funded, which is essential for the increase of our workforce and, in fact, the sustainability of our workforce. So, as mentioned, it has broad bipartisan support. In the previous Congress, it had 222 co-sponsors.
With one co-sponsor of the same party.
189 Democrats and 33 Republicans in the House, and in the Senate, 15 Democrats and 2 Republicans. So, in the shadow of the pandemic, however, this has become even more important. And the fact that we are continuing to grapple with the current shortages of physicians, and it's only going to get worse. So this provides an increase in a number of priorities that not only this administration, but cardiac surgeons in general are in favor of, particularly making sure that the underserved and rural area constituents are being, that their needs are being met, and that access to cardiothoracic surgical care is also available to all. There really isn't any major opposition to this legislation. That you may hear some
yes, there is, because niggas don't know about
whether
it.
government funding for GME slots at appropriate levels is an issue that needs to be addressed. But as we've already reported from the American Association of Medical Colleges, there are 10,000 residency positions receiving no support from Medicare. So the need is there. The institutions are actually, because they are over their caps, are continuing to fund residency education. But that shouldn't be the way that this is funded. It's not the way that it was intended to be funded. So again, it won't solve the workforce shortage, but it is a significant step in the right direction. And without further congressional action, this problem is only going to get worse. The physician pipeline, when you think about it, from college to medical school to residency to being a faculty attending physician, is a long one. And it's going to take many years to overcome the shortage. But we hope that you'll ask your elected official to co-sponsor this really important legislation. Thank you.
Okay, so yeah. Okay, I knew the numbers wasn't making sense to me, but they do now. They do now. That's a waste of fucking thing. Did you know there's okay? It's over 100. Okay, so it's over 100,000 different doctors graduate a year.
Mm-hmm.
Over 100,000.
Yes.
A year.
Mm-hmm. How many of them are American, and how many of them go back home to practice?
Well, they got to finish their residency first.
No, sir. If you're going back to India,
well, yeah, they have different standards in India.
You got a medical degree.
Yeah, you do.
You go to Columbia, you got a medical degree from a U.S. university.
Yeah. I didn't ask that question. So it was 104,000 that graduated between different specialties and actual MD or osteo something, whatever the hell it's called. Over 100,000. What's up, Lord ADS? That's crazy, and they still only have 40,000 slots available. Yeah. So that's 60,000 that graduate that don't have no residency program to go to. If they don't leave.
If you made residency 8-hour shifts, you would eat up that entire overage.
Yeah, absolutely.
Just by making 8-hour shifts.
Yeah. That's crazy, man. I don't care what it said. That's motherfuckers that spent over $100,000 for schooling, well over $100,000 in schooling, that just have to either sit down, go to Doctors Without Borders, some shit, just to get your
overseas in practice,
just to wait for them to say, okay, yeah, you can come on now. You can finish your residency now. That's great. That is insane. Yeah. How did I work in the medical field? Did not know that shit.
Well, and number one, right? This bill is fixing a problem that the government made by limiting the amount of residents.
Yes, that's
in
crazy.
Fucking 96 with Bill Clinton.
Yep. 96 was the year that fucked up all the doctors. And medical care, to be honest with you, because again, I'm saying like this: more doctors, more motherfucking competition, which means motherfucker, your prices is gonna be lower because everyone ain't gonna go for the most highest price motherfucker. Motherfuckers ain't got money like that. So yeah. Oh, mama said not having enough slots open guarantees a way to weed out people that graduated to probably shouldn't have. Oh, some go to camp. Okay. That's understandable. That's what Mayo was talking about. They go back home.
But then again, why did they graduate, right?
Yeah, how did they graduate?
They should have never graduated. That should be a function of the medical school, not the fucking residency program.
Yeah, I agree with that. Hey, how's your medical care been there, Lord ADS?
Excellent, brother.
Excellent. I'll be right back, Tom.
All right,
this time
I
for
got
real.
The VA, and then I got.
Go ahead.
I got the VA, and then I got then I got my own benefits, right? My own type of got the name of this damn company. I forgot the name of this damn company, but through my job though, right? So I got work benefits.
It's like a co-op.
So, exactly.
Okay. Yeah, kind of figured. Yeah, I only stay with, like I said before, I only stay with the VA because it's just easier to have all my records in one place that I ain't got to go scatter around looking for the motherfuckers. I know exactly where that. For me personally, now my wife, she does TRICARE. My son, he does TRICARE. So I don't even get insurance through my work because I'm not paying that much fucking money for this shit. Fuck these motherfuckers.
I get that shit. I mean, shit can't get expensive, like super expensive, right?
Dude, this is my $475 every 2 weeks.
Jeez.
Nigga, kill yourself, dog. Ain't no fucking way. Listen, ain't no wonder why she said she paid $400 for an inhaler. I said, come see Big Daddy. I got 9 of them sitting in my cabinet right now. I got $100, nigga. I'll cut you a break. Give me 100, you good.
Yeah, I got a couple of used ones around here. One of them already, I think both of them out though. But for a minute there, let's just keep it real. I mean, $8 for any medical prescription through the VA beats the hell out of trying to go, saying private with this stuff, right?
Yeah, all mine's free.
I got to pay $8 per prescription.
Shit, I blew up, so them motherfuckers blew my ass up. Well, they let someone blow me up, so fuck it. Y'all gonna have to pay for that shit.
Yeah. Hell yeah.
I'm a bit real. Listen, when I was that mother, y'all think I'm gonna let y'all get me out this motherfucker without paying me? Oh no, you crazy. Nigga, you crazy. My brain wasn't fucked up before I got in this bitch. I didn't get blown up downrange for nothing, nigga. You ain't gonna just kick me out.
Let me tell you, Tom. When I first got out, I didn't even want to use the VA. That's how dumb I was, right? Because I had a kind of that pride shit going. You know what I'm saying?
Yeah,
Where
yeah.
I
A
was
lot
like,
of
I don't
people
want
do
to have
that
no
shit.
government help. Yeah.
Yeah.
And
I
boy, did
wouldn't.
I
I
learn
wouldn't
quick?
advise it.
Yeah, when them bills start coming in, did I learn quick? You better take your ass to the VA if you need a prescription. You better take your ass to the VA if you need to get your shit checked out.
That's a fact. I ain't no pride me, nigga. Listen, what? Oh, let me go ahead. You know what? Like, listen. Oh, I need some. What? Oh, you want me? Oh, I gotta take an eye exam. Oh, you want to pay for it? Oh, no.
No.
Oh, we ain't doing that. Dentist? Oh, I got to go to dentist. Oh, I cracked like my tooth cracked right now. The reason why I ain't went up there yet or try to have a merch because it don't hurt, right? I just chipped it. Is it annoying?
$2,300.
Is it annoying? Yes, it's annoying in the motherfucker. But it ain't hurt.
Tom, outside of my dental care, my eye care, and anything serious, I go to the VA. Now I know what they do at the VA when it comes to dental care. Your dental care is getting your tooth pulled. And how many of these teeth do we need to pull?
No, I ain't had my teeth pulled yet, nigga. Them motherfucker. No, I mean,
All
listen,
of them.
I shit. I have
Pull
2
all
teeth
that nigga
missing.
shit. That nigga old.
I only got 2 teeth
I'm talking
missing.
about Lord, yeah.
Oh shit.
Yeah.
Hell no.
It's
I don't
all
listen.
about-
I have the best dentist I think I ever had in the military and outside the military. This motherfucker come in, little Asian nigga like he like I want to say he like 5'6". Motherfucker. So how you doing? He like, listen, he explained everything before he do it, nigga. Shit is crazy. Like, look here, man. I'm gonna go ahead and hit this back molar over here. I'll make you make a bite. Do that shit right there, roll it around. Little Asian dude. What cool. His name Dr. Jack. Dr. Jack.
Brother, the only question I'm asking when I go to the dentist is where's the gas, nigga?
Dog,
Where's the gas?
you ain't gotta give me gas. I go to sleep while he in my mouth, dog.
Damn.
I'll be passed the fuck out. Dead ass serious. I don't give a fuck,
But
man.
Lord, yes, I'm not that strong. Just go ahead and put me out. Wake me up when it's done.
Yeah, listen, that motherfucker I mean that bitch knock the fuck out, nigga. They give me well, I wear my shades. So where my shades at? I be like this. It be like, you might get a little water on your face. Don't worry about it. You know me, doc. I'll be able to bit.
Let me tell you what. You ever hit that gas with a blunt? You smoke a good blunt before you go in there and hit that gas?
I have never had
nice.
gas. And yeah, my bad, Zoomer. Yeah, pause. He don't go out while that shit was kind of gay. But yeah, no, I've never had gas ever. My wife has had gas. I haven't had gas.
You hit that gas with that blunt, that shit is nice. I mean, that shit is real nice.
Well, I don't
my first removal of my teeth. I had to tell the niggas to put me in gas. As soon as he put that little device on there and then with that little hammer to yank them bitches, I said, "Oh no, look here, brother, just go ahead and put me out, nigga." And then that nigga said, "Doot doot doot," and then by the time I woke up, my shit was done. But I still got to go get some more. That was like shit, 12, 13 years ago.
OG, the first time I got a tooth pulled, that bitch was so infected. Oh my God. Ask Kai. It was so bad. It was nighttime. I was working in Oklahoma City at St. Mary's Hospital. Nigga, I was outside in my car, nigga, damn near in tears how much pain this shit was. I was like, I just can't take it. I can't take it. This little motherfucker put that clamps on my shit. The bitch was so infected. I was like, you got to get this bitch out of my motherfucking mouth tonight. She grabbed that bitch, no numb, no nothing. Crept and was driving that bitch like this and did a little wiggle like that and pulled up. That bitch popped out. Said, "Oh God, thank you, Jesus." Oh, I mean the release of goddamn. She's like, you gonna have to spit all this shit out. I'm out there like that. Hey, That pain was something else, dog. Oh my God, I don't wish that on nobody. Well, yeah, I don't wish that on no one. That shit hurt, dog. That
Like
shit.
I said,
That
it
should
ever
have
get
made
to
you
that
kill
point with
somebody
me,
for real, for real.
I'm doing what my grand told you. I'm doing what my granddaddy did. Knock all these motherfuckers out. Give me some dentures. And I need all my dentures covered in gold, nigga. So when I slide my teeth in, I'm still shining.
Take all these motherfuckers.
Yeah, nigga. Take all these motherfuckers. I don't give a damn about them. I'm gumming. But nigga, when I put these dentures in, nigga, I'm shining like a motherfucker. But that old nigga, yes.
You know they got motherfucking whole plates that you can put on that what they call that fucking they put the little drill. So before I'm gonna tell you like this, before you lose bone in your gums, have them drill the taps in there for the fucking not dentures. What are they called? God dang it, my parents got them.
Whatever it is, goddamn it,
I
I'm
know
gonna
what
get them
they. I
bitches
know what
covered
you're
in
talking
gold.
about.
Yeah, put those motherfuckers in, and yeah, get them bitches covered and go. Don't just do dentures, because dentures you gonna look, man. Them shits fucking suck. Just have them put them fake ass pearly whites in that motherfucker.
I ain't doing that. That shit look too fake. You gotta cover that up.
That's what I said. Cover it up and go, nigga.
Yeah, if I'm gonna have to, because I can't look at that shit, bro. That shit. My auntie got this shit, and I look at her different every time. I'm like, I'm glad you got it. Your teeth were fucked up, but I'm glad she got it.
You know what you should do? I'm gonna say this to everyone. If you don't want the whole everything is straight shit, have them go get an impression of your teeth now. And
Veneers.
The veneers. Have them make an imprint of your teeth now. They will make you veneers that look like your teeth. Your exact mouthpiece. Veneer implants, that's what they are. Yeah. So do that. I should have told my dad to do that, but they don't listen to me. He don't listen to me anyway. I'm too smart for him to listen to. That's what he said.
Yes, you can put in that bit. If you're gonna take a tooth out, replace it with a gold. Nigga, I don't give a damn.
That bitch is gonna be all straight.
Yeah, I don't give a damn. Yeah, as long as I can eat ribs, nigga say like I tell my nigga, hey, I can eat my ribs and my brisket and shit. Nigga, I'm good, nigga.
There ain't nothing wrong with it. Fuck it. This is gonna be the last one that we can go off the motherfucking rails with this shit. I haven't watched this, to be honest with you. I found it. It said some shit I liked in the title. And I was like, oh, okay. And of course,
to the Rife Technologies, and I found another that's suppressed out there, and I offer a $10,000 reward. I literally received thousands of calls, but one man impressed me. One man. And he said, there's not one cure for cancer that's been suppressed, there's been 5. So I started doing research into the Rife Technologies, and I found another man who really knew quite a bit about Rife and had all the frequencies and everything, and I went to see him and showed me that I wasn't using the Hertz rates to get rid of cancer at all. And I looked at the Hertz rates that I was using, and lo and behold, there were Hertz rates to get rid of worms and parasites.
The CDC reports right now 1/3 of Americans have parasites, and yet not a single medical doctor in America even knows parasites exist in this country.
We came up believing that we got sick because of these crazy little invisible virus particles. Well, that turns out not to be true.
There's a distinct anti-science flavor to this. So if they get up and criticize science, nobody's going to know what they're talking about. Because I represent science.
That nigga represents science. Y'all remember that? That's your boy right there. OG, that's your boy.
Who's that?
Dr. Fauci, get the jab, nigga. Get that jab, nigga.
I ain't get that shit. I'm still living. I'm still alive. Nigga, shit, I ain't take that shit.
Hey, Lord ADS, how many jabs you get, dog?
I got the jab, the booster jab, the jab booster nigga, the back and forth booster, the what is it, the walkie booster nigga. I got the black booster, the white booster, the gray booster.
You sound like my dad now. That nigga got
that shit.
He a spike protein farm.
Well, you better continuously work out, because once you stop, nigga, your health gonna go down.
I have a question since you said you got those boosters. I know you bullshitting, but if you did, right? Why would you get something that didn't work 7 times before that?
Worked for me. I caught COVID back in 2020. Literally on Valentine's Day 2020. Y'all
Okay,
niggas
cool.
ain't know. Y'all niggas didn't know what I went through.
But okay, that's fine. But what did the boosters got to do with it? How many boosters you got? For real, for real.
I think 2 or 3. I'm about to go get another booster in the next couple weeks.
If it didn't work,
you caught COVID, right? So your body built up an immunity to it.
You would think so, right? But you can catch it 2 or 3 times over, brother. It ain't just one time because it keeps the virus keeps transforming into other viruses. So you got to be like careful of that stuff, dude. Because you can't get caught up.
So what's the shot for it for? If it's not immunity.
It's to fight off the other like strains of it.
And your body don't do that?
I don't know. You know what? Keeping it real, if you ever caught COVID, you'd be the same way.
I did.
I did catch COVID.
No, you didn't.
Yes, I did.
Brother, I was laying in bed, literally dead ass weak for 3 days. I ain't never caught nothing like that.
Oh, not the 3 days, not the little flu you had.
That sounds like the flu to me.
No, man, it was COVID. It was serious stuff. My body just recovered from it faster than
No shit. Everyone's
would.
body recovered except for old motherfuckers.
Mm-hmm. And the very young.
Mine sure did. Yeah, mine sure did. Nigga, I got through it.
Nigga,
I knew I was out of there. Bones was weak. I was weak, nigga. I was throwing up. I was doing the ultimate, nigga. You know when you anytime that you cough, you throw up in shit. You was toe up, nigga. Like you thought you was about to die. Every time you took a breath, you thought it was your last breath, sir. We was there, and then
I wasn't there. I was
there, bro. And I thought it was just some bullshit. I thought I had like a little virus or something, nigga. I was like, then everybody else caught the shit. I said, oh yeah. I said, yeah, we got it. But you know what? We pulled through, brother. You know what I'm saying?
OG,
the immune system.
My oldest got it twice, I think. My middle son got it like 3 times because he's in the Navy around all them nasty niggas. Kai caught it twice. Her ass the first time, she was about dead, nigga. She was about dead in the mud. She was almost about here, dog. She had double pneumonia and all that shit, COVID pneumonia. So she had COVID pneumonia. And they didn't even do the right things for a regular pneumonia. So these motherfuckers, listen, the pure motherfucking lack of knowledge just based off of being a fucking medical nurse or doctor, any of that shit. You would know for anything pneumonia, you still do the same thing. It don't change. The key word in the shit was pneumonia.
Yeah. And you have to treat it, which they didn't do under COVID. They did not treat you for pneumonia.
Shit. Nigga,
How long did you go without tasting, Lord Yes?
About a month.
Nigga, I didn't even know I had COVID, nigga. I didn't know I had COVID until I went and I had to take a test to go back to work. And guess what they said? Oh, you got COVID. I said, oh, okay. Well, I'm going to sit at home for another 3 or 4 days. I said, let me go take another test in 3 days and see what that. Oh, you don't have COVID. Oh, okay. So I don't have COVID. Now, the second time I supposedly caught COVID, I was doubled over. My back, it wasn't even that I was doubled over in like stomach pain or head pain. Nigga, my back gave the fuck out, nigga. I thought I couldn't walk no more, nigga. Yeah, that was it. I felt like I couldn't walk. Nigga, my back.
That happened to me in the middle of the week. It took me about a week to get over the shit after everything. Because I think, like I said, I got sick from eating out, but that just let everything else take a hold of me.
Mine was drinking alcohol, nigga. I went out.
Yeah, you let your system get low.
Yes. Every time I get sick, it's because after I just got done drinking. When I get done drinking, my body and my immune system is at its lowest, and that's when everything attacks me.
Nigga, I remember it just happened to me all of a sudden. I thought, I was laid out like one of them frogs, nigga. I was laid out like a damn frog, bullfrog, stretched all the way out, thinking it was gonna be my last. They gonna come eat me. I'm done.
You know what I'm saying? I've been boosted 6 times, nigga. I said,
I'll get my booster because I know how that feel. Be laid out like a bullfrog.
You understand that the boosters is Do you do any research on anything that you put in your system that hasn't been tested?
Brother, I've been treated for Ultimate Orange, all that
No,
good shit.
I hear you, but you didn't answer my question.
Nigga, I've been treated for anthrax. I done got anthrax shots.
That's because you
Nigga, my
retarded.
bones glow, nigga. My bones glow.
Listen, nigga, you retarded. You allow, so you are the ultimate test dummy.
I ain't doing that.
Do you really understand? Ooh, wee. That's bad. That's bad, Lord ADS. That's bad. That's not a good thing.
That's why when you go to the hospital, bro, for shit that you sick for, unlike you, I make sure them niggas do other shit just to make sure I'm straight. Need you to check everything. I understand it ain't got nothing to do with that, but I don't want to die. So you know what I mean? You go ahead and make sure that shit's straight too. Just don't send me out here with a good bill. Make sure my bill is good, nigga. If I gotta pay you bitches, nigga, you might as well go ahead and just charge. Go ahead and, you know what I'm saying? Run that shit up, nigga. Let's go ahead and check everything. I ain't trying to get sick. That's the whole point of why I'm coming here, because I'm sick, nigga. I'm not trying to be there no more. So, but see, some people, they just don't give a damn.
Yeah, I like to do research on what's happening with my body. Not to mention my body rejects almost everything. For some odd reason, my body rejects it. And it's terrible. Hell, I can't even use most soaps. My body hates me.
Tom, I'm gonna get that booster shot, Tom. We'll get
Go,
that, I don't care what nobody says.
Go ahead and do what you gotta do, nigga. Go ahead, do it.
The world needs crash test dummies too, sir.
You are the ultimate test dummy. It's okay. And here lies Lord ADS. I'm going to get that booster shot.
Yeah, see, the problem I got with what you doing, Lord ADS, and we talking about these motherfuckers putting parasites in humans and shit by the way we consume stuff, sir. You ain't doing nothing but amplifying that shit, because everything they put in you is modified. So, nigga, that shit probably ain't gonna do nothing but accelerate with everything else they putting inside your body.
They're gonna keep shooting me up till I get superpowers, OG. They'll keep shooting me up till I get superpowers.
Yes, sir. You gonna get power to fly to the other side, sir.
That's
just gonna be a superpower.
Ghost Man. What up, though, Ghost Man?
For your parasites, you eat up with them. Hey, I would take ivermectin, but I guarantee you, I'm gonna be honest with y'all, and I said this before. I think I said it before on here. I know I've said it at work. Ever since I did that 7-day fast, my body hates alcohol. It fucking rejects alcohol. So that's why you don't see me drinking a whole lot no more. Have you noticed I haven't been drinking?
I ain't never seen you drink, Tom.
Yeah,
I think you've drank twice since then, Tom, on screen, and you didn't finish it.
Yeah, I can't, dude. I literally can't drink no more. My body starts breaking out in fucking sweats and shit. Dude, it's so stupid. I instantly get my whole fucking body feel like it's gonna shut down. So I don't even drink no more. Not like I used to. When I go out to eat, I get a little margarita, but I don't even finish the bitch, and I waste money. And I know I'm not gonna drink it. What's up, Boston Christian? But I get it anyway. I don't know. Nostalgia. That's probably what it is. It's nostalgia. I like the taste of margaritas, but for some odd reason, alcohol does not work with my body no more. So
there's that. Early. Yeah, I know that. Starting on that same thing it did to me. Good with you, boss. That's why I don't drink no more.
Bro, I'm being honest. Ever since that 7-day fast, I don't eat as much as I used to. I can't drink. The only thing I fucking can't stand is my nose is running more. So that's one thing I can say that my nose is running a lot more since then.
Y'all niggas smart. How long does it take the stomach to draw up?
4 days, right? Out there.
Average is 4 days. I think the average is 4 days.
4 days.
Something like that.
Hey, Tom, I'm getting ready to drop, brother. I'll holler at y'all a little later, all right?
For sure.
Yeah.
This nigga said he got 7 boosters, nigga. I'm gonna keep. Is it because I'm getting old? Listen, you might be right. I'm not gonna say that. I'm not gonna deny that, dude. Listen. They keep asking me to play football. As much as I have that itch, I'm like, I don't want to be hurting. This is the best I've felt since a while, where I don't fucking like hurt. My ankles are not hurting, my back's not hurting, and all these. I know I need to slow down on certain shit. So there's that. But I can't say I'm not gonna play next year. I'm just saying right. No, I'm lying. I didn't say that on the mic. Hopefully my wife ain't watching. I'm not playing next year or this year. That's the game plan. We're playing golf now. And I might get into, what is that one game with the pickleball? My son keeps talking about pickleball. I might get into pickleball, whatever the fuck that is. I don't even know what the fuck it is. But it's something, I guess. So
Man, that nigga sound like me. I'm out there playing frisbee golf. I say I ain't doing this shit no more.
Oh, frisbee golf is fun, bro. I just need a group to go with. But the group that I would go with that actually plays every weekend, they drink all the time. So it's I don't have the love for frisbee golf like that to go say I'm gonna go every weekend and play. I don't. Golf, on the other hand, that's different. I'm going for fucking down and distance, bitch.
People don't bowl no more like that. People don't play pool like that no more. So I'm just
It's different, man. These times is different than because we had to go outside. That's what it was.
Mm-hmm.
It wasn't no staying in the house, looking at each other, looking at you, looking at me.
Yeah. And a lot of adult sports leagues are just designed for people to get together and drink.
Yeah. That's how they did in softball. That's why I stopped playing softball. Because all the motherfuckers did after the game was drink. And I just like, nah, you ain't teasing me, mama. I know I'm getting old, man. Listen, I got a whole bunch of gray chest hairs. I know I'm old, nigga. Yeah, mama, you gotta shade them bitches off so you don't see them and shit. Cause I know like this whole side, my whole right side is full of gray chest hairs. I just shade them bitches off so you can't see them no more. Fuck it. I ain't got no more gray hairs, chest hairs no more. Cause I shaved them off. But let's go. Let's let Dr. Fauci tell us the truth. He is science.
The CDC reports right now a third of Americans have parasites, and yet not a single medical doctor in America even knows parasites exist in this country. So I find it very interesting that the health agencies of America can tell you a third of Americans have parasites called protozoa. But every medical doctor that graduates a med school in America graduates being told parasites don't exist in America.
That's crazy.
It's interesting that a third of Americans have parasites and are sick from those parasites. And it's been amazing to watch a lot of medical doctors around the world get excited in the last 5 years about the reality that anti-parasitic herbs and drugs can cure most, if not all, cancer types of tumors, masses, no matter what stages. There's a direct correlation between parasites causing diseases that include cancer diagnosis, autoimmune diagnosis, and it's nothing more than inflammatory reactions to parasites living in the human body. Yeah, great. So why do I think they've suppressed information about parasites in America? This is huge. Okay, so let's really focus on America here because this is important.
Hell no. I'm sorry. I can do all that shit. I just can't do bugs. That bug shit kill. That's just
That shit crawling around your gut right now.
and that's why my stomach all fucked up. It got all these goddamn worms, man. God,
yes, sir.
God, I need to start taking
your
some
intestines is nothing but a slip and slide for the parasites.
Woo-wee, that shit nasty, dog.
And Tom, don't you think that maybe this is one of the reasons they didn't want people to take ivermectin?
Yeah, I know that's the reason. I know that's the reason. Shit.
One of the drugs with the highest safety profiles in the world for negative reactions. The lowest amount of negative reactions in history.
Man, I have a problem eating fucking uncooked food. Like people be eating that motherfucking tuna tartare.
And sashimi.
Yeah, fuck that. That's just nasty, dog. I'm like, you about to get worms, nigga. You about to get worms, nigga. God, that's nasty. OG, how many worms you got inside you, dog? You got a tapeworm, nigga? Oh, that nigga left. Anyway, let's continue.
There's this huge pharmaceutical complex. So there are companies all around the world that are making trillions of dollars combined every single year manufacturing drugs in the form of prescription pills and injections. Okay? Called vaccines or even injections for all types, insulin, weight loss, diabetes, you name it. So injections and drugs, vaccines and drugs.
We grew up believing that there was infectious disease that was airborne. We heard about the pandemic of 1918. We came up believing that we got sick because of these crazy little invisible virus particles. Well, that turns out not to be true. So what we are dealing with is an intentionally misinformed public who has been lied to by big pharma.
All right, so why is this important to Americans? And this entire topic about why are they lying and covering up information about parasites causing illness and disease in America? This is why. There's only one real reason. All right, so drug companies around the world make drugs and vaccines, and when they sell those and have insurance pay for them or government agencies pay for them with different agendas or projects, they make trillions of dollars on selling drugs and vaccines. Okay? That's what they make. All right, so cancer is being misdiagnosed as cancer as long as you don't teach your oncologist that cancerous tumors and masses can be parasitic egg sacs or parasites at all. So if you don't tell them MDs in school that they're looking under a microscope at parasite egg sacs, and instead you tell them that's what stage 1 cancer, stage 2 cancer, stage 3 cancer, stage 4 cancer looks like, and you're going to now prescribe
this guy's a little bit on the conspiracy side here.
I would say so, but I don't know. Listen, I always hear everyone out. I hear everyone out. Cause listen, they know more than me, goddamn. I don't know nothing about this shit, but
because I doubt that football-sized tumor is a parasitic egg sac.
Oh, I agree with that part, but see, my whole thing behind that is, Mayo. Hear me out. They can call it conspiracy if you want to, right? That would be your body. You know how when you see you got a wart or something, it's your body collecting all the shit that they're trying to get rid of and putting it in a sack. So what you do,
surrounding it to protect the rest of the body.
Yes. So they're supposed to cut the whole thing out and get rid of it, right? That's how I look at it. Now, regardless of what it is, your body was built to motherfucking fight off infections and fight off foreign bodies of shit, right? Yeah. So that's what I figure is like it's your body trying to fight some shit. So if you see a pileup of clumps of shit, that's your body fighting that shit off. And what to tell you to do, cut that shit out, nigga. That's me. If it can be cut out, cut that shit out. Don't biopsy your shit. Let me take a little slither of it, because what you're doing is you're reopening. Yeah, you just fucked up with your body. Literally, motherfucker said, I'm trying to get rid of, so I'm gonna hide it right here in this sack. Maybe someone can come by and cut this bitch up, But hey, I don't know. Yeah, I hear him out.
Billions of dollars every year.
If it was like parasitic egg sacs, like you're saying, Tom, after the eggs has to go away.
Not necessarily go away, but I understand what you're saying.
No.
But yeah, all you're gonna do is form more, actually.
MD in school that what you see under the microscope is parasites that can be killed in 2 months, and we're going to eradicate the entire cancer industry by like 90%. You would no longer be selling chemotherapy, radiation, and surgery in the trillions of dollars worth. Therefore, you are better off training your drug dealers, called MDs, who never know the truth of what they're seeing in a textbook.
But he's talking about if they catch it early, though.
That has a label on it that says this is stage 1 metastatic prostate cancer or breast cancer. So if we don't tell the medical doctors that parasites
but metastatic means something different in America
that they don't exist at all.
I mean, to spread
there's going to be a whole bunch of people sick with parasites. The MDs are never going to figure it out, but they're going to prescribe one drug after another, one surgery after another, and we're going to make trillions of dollars all along the way.
Oh my
and
God, I would
all
fucking
the MDs
die.
Pawns, these intellectually brilliant-minded human beings wanting to help people around the world. You are being used.
Wonder how many of these videos are veterinary in nature.
Profitable carnage.
Probably a lot, but that's still nasty as fuck.
One of the first things is prior to even years before COVID-19, since 2009, I actually took an approach every month that our entire family did something every single month to cleanse and detox parasites. So this has been a long-standing thing for us, knowing that pets carry parasites. Yes, all dogs, cats, birds.
Wait. She said, my friend's tumor had teeth and hair in it.
Oh, no, but that's an absorbed body from the fetus. That's what that is. That's what that tumor was. That was literally.
It was a baby.
Yes, that was a baby that did not survive in utero.
Oh my God!
By the other fetus.
Shit. My granny used to smell our breath to see if we had worms. That is disgusting. That is fucking disgusting, Mama. But, you know what? You have a point there, right? Because I always know if my breath smells like metal or something, it means I'm dehydrated. Well, to me, I know I'm dehydrated because I can smell it and I can taste metal in my mouth. That means I'm dehydrated. To me.
Well, you know how they used to get worms out of you, Tom? Tapeworms.
No,
they used to starve you and put food in front of your mouth. And the worm, when you breathed in the air.
Stop lying.
I'm serious. This is back when they used to bleed people. That's how far back I'm talking.
I watched it. Yeah, I watched a documentary on that.
That shit is crazy. Yo, that shit, man, that's crazy.
And they probably do the same thing with your butthole.
Yeah.
Oh,
somewhat sort of. But when they do extract it, they don't do surgery. They just pull it.
Yeah, I seen that. The same way they do the dog when they pull the worms out their asshole out of them dog. That shit nasty too.
Man, the motherfucker's the strongest son bitch. The motherfucker.
Most of them are designed with them little hooks in them.
Yeah.
So it's hard to pull them out.
It's called a teratoma. Okay. All right. Let's continue.
Donkeys, cows, horses, they all have parasites. Pigs, they all have parasites. So we can get parasites from our pets. We had pets, we had dogs, we had cats, we had chickens, ducks, goats, you name it. So we always made sure that I was preventing those with my family. Parasites, this is very different. So in my practice, we treated autoimmune diseases from all around the world. 16 different countries came to my practice in both Tennessee and Texas. And 80% of all the people who had autoimmune diseases had
He's a
parasites.
doctor and chiropractor?
I never had to use ivermectin and never had to use hydroxychloroquine.
That's the ones we talking about that Mayo.
I never.
That's the one we talking about.
They had
We got the little hooks in there.
psoriasis, yes, caused by parasites. If they had hives and if they had lupus, which is caused by parasites. If they had rosacea, which is also caused by parasites. Every rosacea and lupus patient, you have parasites in your spleen. I never had to use ivermectin or hydroxychloroquine to kill those parasites when they had these disease states. I typically would use a 5-day on, 5-day off approach of using herbs from plants.
That's my first time hearing that, but
kill worms of
that's new
parasites,
information.
break open eggs of parasites, and so you would
Yes,
cycle
sir.
these
This is
things
the doctor
5
of
days on, 5 days
chiropractics,
off.
so.
The primary
No, I didn't know
ones
that.
used
Okay, pause this real quick.
were worm.
So people with lupus and people with those type of, you know what I'm saying, shit like that, they have. That mean most people they born with those diseases, right?
I think
You can. I know you can get it later on, but
yeah, I don't know. I know my mom
know
got
it's a lot of people-
fibromyalgia, so yeah.
I know a lot of people born with lupus. I went to school with people that was born with it. I had family members that had it their whole life, and I'm thinking they was born with it. So
I mean, it's possible.
well, he said they parasites though.
Yeah, it could be parasites. I'm not saying you born with parasites.
No, I don't
You
know.
got it from
brother.
your
I'm-
mama.
Yeah,
That's sad.
there's no evidence to this. This is just
Okay.
what the doctor of chiropractic is telling you.
Okay, I was about to say it didn't sound right.
Sir, that's what the DC at the end of his name means, sir.
He's an herbalist, son. He's an herbalist, son.
Oh, sir, he's the doctor of chiropractic, sir.
Well, that means so you trying to say he's not a doctor though?
Sir, OG is more of an herbalist than this guy.
You don't know that.
Because he grows herbs, sir.
You don't know that.
Oh, you're just gonna just manage me like that? Okay, that's how you do it.
You talking about me? You talking about me?
No, I'm not talking about. I'm talking about you, nigga. You see, man,
I
your
know.
niggas gave me an accolade and said, nigga, I might be better than this nigga. You know
You
what I'm
might
talking
be,
about? I'm an
but you might
organic.
not.
The
This doctor
OG
of
doesn't stand
chiropractic, sir.
don't stands for original gangster, sir. It's the
Stands for
organic
organic
grower.
grower. I know you
Yes.
told me before,
Yeah,
motherfucker.
yeah. Try to throw a tundra on you. You know what I'm
All right.
Wood extract, otherwise known as artemisinin. a plant.
Artemisinin.
And it has some of the very same actions in the human body to protect you from parasites as ivermectin does and hydroxychloroquine. So I always used wormwood extract, and I used dandelion root extract, which is very anti-parasitic. And then we also used other herbs and plants, and there's many actually. So we just use continually combinations of these plants, and they're very, very effective. We used oregano, we used clove, we used a whole bunch of different essential oils from plants also in a way to kill off parasites.
Parasites are mostly encysted and they're in a kind of a stasis in these little areas around the body. And when you take your dose of medicine, whether, whatever medicine you do, whatever you do to get rid of the parasites, the first thing they're going to do is get rid of the mother parasite. The mother parasites apparently put out some hormone or chemical or signal that cause the babies to just all stay encysted. So they're not out making you sick. They're not swimming around. But the minute you get rid of the mother parasite, these things start hatching out. And this is why you need to cycle the drug. You kill off some, then you let more come out of these cysts, you kill them off, and you have to do this over a long period of time. Now, here's where the problem is. If you wait too long in between doses, what will happen is you'll have such a big parasite hatch out that you will actually kill so many parasites your next round of drugs that you will get what's called a Herxheimer reaction. And what happens is these parasites will be suddenly killed, and they will give you like an allergic reaction to dead parasites. No surprise that your body doesn't like a lot of dead parasites. And you'll notice it. You'll notice your stools will change. You'll have all these things happen. It turns out everything cancer likes, parasites like. They like carbohydrates. Okay, and the solutions are a clean diet, low carbohydrates, cycling parasite doses until you can get yourself down to 3 days on, 5 days off, and then you keep, after a few months, you start.
Inflation is destroying your
Oh,
savings.
no, it didn't.
But gold
No,
and
it
silver
didn't.
have protected
I'm not
wealth
paying no
for
rumble.
thousands of years.
Spreading out the off time until you're down to maybe taking 2 doses of parasite medicine a month. And a lot of your doctors don't even know these things. So here's what you need to know. We get sick because of 3 things primarily. We get sick because of electromagnetic radiation, because of poisons that they put into the environment, and because of parasites. But what if I told you that cancer, acne rosacea, multiple sclerosis, and rheumatoid arthritis, 4 different diseases in 4 different areas of medicine, what if they can all be treated with parasite medication?
If you have multiple sclerosis, the universe and this planet for millennia. For example, one of the most recent plagues that killed millions of people, and we're talking 2.5+ million people we have records of, was a condition called scurvy. And it was global. People were dying all over the place from a condition called scurvy, but no one really knew what was causing the death of these mariners all over the world. They just developed signs of nutritional deficiency.
Watch the full documentary. Parasites, the cancer within.
That shit.
Oh, yeah.
That shit was moving in his lip, dog.
Yeah, that's them bot flies and shit right there.
Yeah, that's different, bro. Wait a minute.
Be about to selling craving ramen.
Parasitemovie.com for free.
That's even
the
fucked
journey
up,
to uncovering.
They said it's parasites on that shit. They packaged the ramen with parasites on them, microscopic parasites that you can't see. People on YouTube are saying if you take ramen, crush it up, and put it on one of them scopes, you will see parasites. I mean, I don't believe it because I eat them, but I was like,
because I eat them.
Yeah, but I do take in a lot of fresh fruits and stuff. You know what I'm saying? So
you trying to get rid of scurvy, nigga?
I didn't know. No, that's what I'm saying. I didn't know that worked, bro. So that's what I'm learning. I wish they would have showed us like the parasites on you know what I'm saying, on something and then putting the juice on there to see how they react to it or something. Because whatever you getting out of there, out of them fruits and stuff, or whatever you using, because he said all type of plants So I would like to see the experiment with that. Like, what does that plant do to that parasite? Because it's either going to kill it or it's going to, you know what I'm saying, it's going to be able to move in there. Now, over time, if it kills it over time, then that I'm thinking, well, what you're talking about, what if somebody they just taking a little bitty dosage? Where he's saying, if to get rid of scurvy, the only thing they was telling them niggas was to make sure they had lemon or orange or something, and then they didn't get it. Well, I'm like, I don't.
It
You know what I'm
did
saying?
something. It did something.
You say you're supposed to be having the cure, nigga, but you ain't putting it out there. I mean, come on now, make some type of oil Nick can drink and get rid of everything.
Don't worry
OG,
about it.
for $29.95.99, he'll sell you a book.
That's a video, sir. It's a video. And it ain't even
No,
$29.95.
he'll sell you a book at the end of that video, sir. I guarantee you.
Oh,
We need
I
to
didn't see it,
we need to combine everything that nigga said in a blender, make a juice and sell it and say miracle drug. This is what they could just save you from everything.
Mm-hmm.
Okay, the system is run through China, Israel, Ukraine, and us now. We didn't used to be as big a part, I think. But anyway, it's like you harvest the organs, and then you got to get rid of the rest. And that's what I think they are doing. It really just says Soylent Green in a different form. And anybody thinks this is just made up. We have videos, for example, in Ukraine of they call them the Chorny Transplantologia. I can barely say that. I don't speak Russian. I just read it. But anyway, it's the black transplantologists. And they stumbled onto these things. I know Putin knows about this. The Russian army knows about this. They underground harvesting areas. So young Ukrainian soldier is not quite dead yet, but they don't think he's going to survive. Boom. 2 kidneys, 2 lungs, a heart, a liver, and the rest goes into the food supply. That part I can't prove, but I'm going to tell you about I can prove about the kidneys and stuff like that. So you've got, he's worth almost $1 million, by the time, and you sell it, you're going to get more than $1 million for that, because that price gets way bumped up. He's getting nothing, but in this case, but if you yourself want to sell your kidney to the black market, you sell it and then they mark it up 10 times, but it goes over these big hospitals in China. They were just there for that reason. So, and they were live harvesting the Uyghurs, the Christians, and the Falun Gong in China.
That's why China's doing the Uyghurs, right? Because Muslims can't take organs from non-Muslims.
Facts.
Because they've been polluted.
Because they probably had that poke in them. You know what I'm saying?
No, real talk. God ain't gonna let them up there. You got that bacon in you. You know what I'm saying?
The whole thing, OG, right? You can do it if you're like, if it's eat a pork chop or starve, it's okay. See, the reason these religions back in the day told people not to eat shellfish and pork was because there was no good way to preserve them, so they were very likely to die.
Okay, well, you explain me the whole shit on their body. People eating shit. I mean, not eating shit, but putting cow shit all over their body. Explain that one to me.
Sir, you'd have to go to an Indian for that, sir. That makes no sense. The Indian cow shit festival?
Yeah, that shit, boy, that shit.
I'm gonna be honest with you. I didn't know nothing about it, but I know where they took it from. If I'm correct, the hippos or something. If the documentary suits me right, those people use the same method, I guess, because of the dryness and whatever else. Because you notice it don't never be around no type of green grass where they doing all this shit at. It always be like bird desert when you see these niggas getting pissed on and shitted on. But I'm just saying, I thought
this was a cow.
I know. Okay. Just pitch this to me. I thought they took that from the hippo. Because the hippo is one of the only mammals, bro, that spreads its feces over itself by their tail.
Oh, okay,
right?
I got what you're saying.
And I noticed that some of these motherfucking crazy ass folks believe in what the fuck these animals do to the max. Like they believe if they do something a certain way, they got to do it. So they take what these motherfuckers do and then they apply it. But I don't know what the use of it is. It don't look like it helped their skin out none.
Well, they said that the cow is a deity.
Yeah, so, the cows are sacred in India. They're the remnants of your relatives that died.
It was Mama said it protects from insect bite. Get the fuck out of here.
Hey,
so
Tom, I put a
Mama, you might be right. I don't know.
Back, sir.
Okay.
I'm gonna go with what Mama said because Mama ain't.
I'm going with that too, but I like I said, so does D.
What is cancer exactly? It's an attack by a parasite, an unusual parasite, which attempts to reproduce its intermediate stages in you. I have to somehow get the word out to the people who are suffering that there is a cure and that it isn't expensive. They can do it themselves and they can be successful. Herbs that kill them all, whether it's the eggs or the redia or the cercarium, myricidia.
These are all the stages.
These are all the complicated little stages, are a wormwood combination, a ground clove, and the third herb is an extract of the green hull of the black walnut tree. You have to use them together because you have to kill everything at once. Otherwise, one thing turns into the next.
Right, right. How long? How long do you have to take this?
5 days or 6 days.
That's it?
That's it.
And what happened? The parasites are...
Yes, all the parasitic stages are gone. Now, you might think, well, the cancer still goes on, but it doesn't. That was the amazing thing. The good news is that when you kill them, all that growth factor is removed. That excess growth factor is immediately removed.
And
the cancer stops.
Hulda Clark says that her zapper, as she calls it, is a parasite-killing machine.
The zapper can kill viruses too. It is an electrical device. It just puts out a pulse of a certain frequency. You hold these two handles and you turn it on. You sit there holding it for about 7 minutes. Then you give yourself a rest for about 20 minutes because what's happening is that lots of viruses are coming out of the parasites and bacteria. We get a flood coming out after the first zap.
That don't sound right to me.
I told you there was a book, sir.
That wasn't her book.
There's always a book, sir. They're always selling something.
I believe her because she way older now. It's from like the 80s, nigga. I'm about to buy that zapper, nigga.
I mean, the worm. She said wormwood, black walnut, the green shell of the black walnut, and clover. But she didn't give the precise measurements on what you mix it into, so I just throw all that
buy
together.
The book, nigga. I buy the book. You heard what Mayo said. Buy the book, nigga.
But she the one giving the information out for free.
Quit try to take it the cheap way, nigga. Buy the book.
You hear me? Nigga, shit. She never gave a nigga the recipe.
Yeah, but OG, that's like giving somebody all the pieces to a car and telling them to build it.
Yeah, you're right.
That's what you're
I
supposed
gotta
to
go through trial and error. I'm gonna be sick a couple of days.
Man, I had this one video where it said we ain't the same.
What is like very toxic if you take too much of it.
No, that's a whole thing.
Yeah. I can't find this fucking. I need to find this real because I was like, yeah, this shit is real. This shit is real. This shit is raw. This shit is authentic. You can't spell bars. No, you can't spell bars without that arse in it. Oh. Okay, let me play Mayo shit because I got some debauchery from Mayo for OG. I got some debauchery. And you know how he loves debauchery and shit. You got Oh man, Mayo, you ain't shit, dog.
Sir, this is their festival, sir, during the
You
wall.
ain't shit, dog.
ನಮ್ಮ ಕಷ್ಟ ಪರಿಹಾರ ಎಲ್ಲ ಬಿಟ್ಟು ಎಲ್ಲ ತುಂಬಾ ದುಂದು ಬರ್ತಾರೆ ಸರ್. ಬಂದು ಅವ್ರು ಆಡ್ತಾರೆ ಯಾರಿಗೂ ಏನೋ ತೊಂದರೆ ಆಗಲ್ಲ ಸರ್. ಒಂದು ಎಳ್ಳು ಮಣ ಅಷ್ಟು ಕೂಡ ತೊಂದರೆ ಆಗಲ್ಲ ಸರ್.
He loved playing the doo-doo. That's what he said. Yeah. That was nasty. Anyway, that concludes the regular broadcasting. Now we're gonna get into some stupid shit I found on Instagram. So here we go.
All the violent immigrants and yes.
We should allow them to what?
Stay here. Okay. Do you think that we could abolish jails, get all the violent immigrants, your words, and all the violent felons in jail? Could we put them here at USF on campus?
Yes, and I'll hang out with them.
You'll hang out with them?
People give people labels all the time, and
No, they named themselves, like they named their own gang, MS-13.
yeah, but you saying violent, which I understand, but gangs are there for a reason. Gangs are there for community, and they're there because, listen, gangs are formed for a community. They're formed because they're lacking something, and that they couldn't
Drug
find,
cartels and human trafficking and sex trafficking and gang raping?
No, that's a byproduct of human evil. That's not what gangs. I'm saying gangs in general, not MS-13.
But you're okay with American citizens going to jail for committing crimes, but you're telling me that when someone that's not an American citizen comes over and commits a crime, they should be allowed to stay.
They should be able to go to American jail.
So you want them to be housed in American jails?
Yeah, they did the crime in America, didn't they?
I think we should abolish jail and we should allow all.
Something wrong with them motherfuckers. Oh, G,
Yes.
what you got? What you got with that, man?
These your educated people.
Mm.
Yeah. The education right there is strong.
Hey, they put them
these
both
two right here.
together.
Yeah. They force is too strong for me. I don't even want to bring them over to the dark side.
Okay.
Yeah, but that was just dumb. She's retarded. But yeah, you can't help them. Baby.
Polo
Yeah,
ting
she
ting.
got a good credit score. That's sad.
Hey, what do you think about this picture though? Let me see if I can zoom it in for you.
Ooh, she got them roll up titties.
No,
First
fuck.
thing I seen, nigga. Do you see them titties hanging? Look like a gorilla. They got the titties hanging.
Yeah, you see the shadow, nigga.
Yeah. That makes sense.
Yeah, we need to stop. That's terrible.
I mean, that was nice. I mean, somebody did the shadow. Now I wish they would have threw the glasses in the shadow. That would have been fire.
It is in there. That's the goddamn eyebrows, nigga. Right up there.
No, her face is literally built like a gorilla.
Nigga, that's her exact shadow. That's a crazy.
No. But I get what you're saying. But yeah, she the way she got her lips perked up and her nose is and shit, I see that. But when it comes to I'm looking at the like I said, they had it. It's nice though. They got it down. I just they messed it up a little bit. That's it.
It said the shadow looks like JP. That's y'all wrong for that.
Yeah, they need a little bump out right at the top. They would have had it.
Let's see. Let me see if I can get this to work correctly.
I'm an English teacher.
You're an English teacher? Okay, perfect. Spell river.
River, R-I-V-E-R.
Put a D in front of river. What does that spell?
What? It doesn't spell. It's not a word.
It's not a word?
Put a D, like the letter D.
The letter D in front of river. What does that spell?
R-I-V-E-R. Like
Yes.
a letter D in front of. That's not a word.
That's not a word. She's an English teacher. Okay. How do you spell driver? Can you spell?
I'm an English teacher.
You're an English teacher? Okay, perfect.
Yeah, they want
Spell
7 letter words. I can spell
River,
that.
That been retarded, dog. See, I show white people being fucked up. I had a whole show the other day about how stupid white people is. And you know what, OG? I even skipped past all the darkies.
That you didn't do, but
Oh, that nigga lied to me, dog. I didn't allow them to talk bad about the darkies that day. Stop it. I even made sure I passed through them because we wasn't talking about the darkies.
you still show them. You be trying now. Sometimes you gotta
that's
let them come through.
crazy.
Man.
That's
We can bet money.
crazy.
Want to put 5 on?
What? How much did the black people say?
No, it ain't. I'm just saying. If I'm saying you be doing a good job, I'm giving you credit. I'm telling you, you did a good job. But yeah, you let something slip in there. You shouldn't have. But you had to do what you had to do.
Here
at
we
the time.
go. Here we go. I can't.
You almost had a successful night. I almost gave you but it was fire. But I just, sometimes, bro, I know it's hard, bro. These
Oh, you know what? There was a darkie on the video. Oh yeah, you right.
So I mean, sometimes we had to let that play though. We had to. We couldn't skip it. So sometimes I got to give you benefit
It
of
was
that.
mostly white. It was
Yeah,
mostly.
but if we see something good, especially when we on X, we gotta make sure we see it. So I ain't mad at you.
27. So you smart. You went to college, right? Oh, you need to get this right then. I don't want your college to look bad. How many hours are in a day in Africa?
I'm not too sure because I've never been. I would love to visit. 12 hours like in here in the country?
12 hours?
12 hours, right?
In a day, right?
Yeah.
Wait, in what country?
Africa, like everywhere. Isn't it 12 hours everywhere? But I know they're ahead of us. They're a day ahead of
It's
us.
12 hours in a day everywhere.
Yeah, but it's
like
ahead
where?
of us. 24 hours and 7 days a week.
So how many hours are in a day in Africa?
We're going by each day, right?
Yeah.
12 each day.
You almost got there. Didn't work. How old did you just turn?
27.
27. So you smart. You went to college, right? Oh, you need to get this right then. I don't want your.
That's crazy work. The most educated OG.
That's a fact.
Well, technically, sir, she's not wrong. Because technically only 12 hours in the day. You're not talking about the night, sir.
Oh,
he ain't all the way wrong with that. And we already talked about this bullshit ass time changing shit. I'm just saying, bro.
Go.
Okay.
Yeah, y'all want to do this shit.
Let me ask you
Okay.
something.
All
Let me ask you
right.
something. When you woke up this morning, what time did the sun come up for you, my good sir?
6 o'clock.
That's some bullshit. You know what I'm saying? They got us locked in on this goddamn time change, nigga. This is crazy.
Last week, what time did the sun come up, Tom?
You hear me?
7:30.
It's crazy.
No, I'm for real. I mean, it's
No, I understand. That's crazy.
7:30, somewhere around there. That's what it was. I was like, that's crazy.
We ain't saying you're wrong because it got dark today at 6. So I understand. Like I said,
Nigga,
you ain't wrong.
so me and my homeboy at work, he's the only white dude I actually talk to on a daily basis now since he came back to the day shift. We talk because Florida voted and said they don't want to change their clocks at all. It passed our House, passed our Senate. Guess where it didn't pass?
Congress
and the federal government.
Yep.
It's stuck right there. So it ain't even bring it up for a debate, motherfuckers. But anyway, here we go. Let's listen to this.
Category of fat I fit in. So it's based on your shirt size. So if you are a 1 or 2X, you are small fat. 3 to 4X, you are mid fat. 5 to 6X, you are super fat. Is based on what level of privilege you have in the world. So someone in a small fat category may not struggle getting on an airplane, but someone in a mid fat or super fat may not be able to use even the airplane extender. So that's where that comes in, and like the privilege levels of like what fat means to different people. I have a question.
Oh, that's fucked up. Bitch, I dress mid fat. You know what I'm talking about? Don't do that. I put on
You
that.
don't need an extender.
Yeah, but see, it's like, bro, when I put on a medium shirt, it fit me. I'm cool with that. When I put on a button down shirt, I put on a large. You know what I'm saying? But in reality, that's something that's forming and fitting. What I don't want is that. So you just gonna call me mid fat because I'm going to go grab me a 2X or a 3X so I can have movement and I can be comfortable in my clothes. So everything I find is extra big.
So to be reality, unless you go to a big and tall place, OG,
exactly.
Most of your extra larges are too short. Not actually not wide enough, but they're just too short. Yeah. I had that problem too.
So they said at the goddamn waist. So you gotta go to a store like that and go get clothes again that fit you. They might be I gotta wear a belt, but nigga, I like to have loose. You know what I'm saying? Shit, I mean, goddamn, the way she was talking, nigga, you really on the cool need either 7, 8X. You putting yourself in this 5 or 6, and it's still tight. That don't make sense. You see what I'm saying? Like, old girl, we were just watching on the thing, the black chick with the toe up legs saying the stupid shit, talking about she went to college. Why would you go buy a 3X when you know good and well you need to be in a 7 or 8X so you could be comfortable? But she wanted to wear something that was tight and fitted.
Oh, absolutely. Why not? Why wouldn't you have anything tight fitted? Yeah?
Hell no, bro, because you can see your stomach hanging.
Okay, let's play this video.
Sparkling wiggle.
Okay.
To get a job, sparkling wiggle.
That's what I'm talking about.
That's a drop right there.
Guaranteed she got a black auntie or uncle.
Oh, that's a whole fact. That's a whole fact. Nothing wrong with that.
I'm just saying. That's all
So,
I hear that.
so you know the chick that we was watching the other day with the blackface? They said she got mixed kids.
That makes sense.
Yeah, that's a lie, sir.
Is it? Okay.
Her kid is fucking white as snow, sir.
Well,
they got pictures of it on the internet. She ain't got mixed kids.
Well, someone said that shit. I said, "Oh, okay." You know, I ain't gonna look because I don't give a fuck.
Yes, sir. TikTok said that, sir.
Oh, okay, TikTok. I haven't been on TikTok, so I couldn't. Listen. Oh, this shit was right. This shit was astonishing right here. We gotta watch this. God damn it!
Look at that shirt, Tom. That weird looking bitch.
And what were the signs and how did they start to identify?
From a young point, they just never fit in. We knew before they did. The day they came out was a relief to us because like, oh my God, they finally figured it out. And luckily they had trans friends. We had trans community. They asked a lot about trans stuff. So I asked one of my trans friends to come over. Hey, can they just meet you and, you know, see you and ask possibly inappropriate questions because they're 7?
This is very clearly grooming. A 7-year-old child is not thinking about their sexuality at all. The fact that this person is even considering their child to have any sexual thoughts is disgusting. Absolutely disgusting. That is very clearly ideas implanted into that young person by their parent because of some sort of Munchausen by proxy situation where they just want the attention of having a trans child.
I have a trans child, yes.
And what were the signs and how did they start to identify?
From a young point, they just never fit in. We knew before they did. The day they came out was a relief to us because
that bitch is retarded.
Okay.
Did you see her shirt? Did you see her shirt, Tom?
Yeah, national, or is it demon something?
Emotional support demon, sir.
Yeah,
that's crazy work, but
with the goat head, sir.
I told you, white bitches is retarded. White liberal bitches is retarded, and especially the fat ones.
Different color hair.
Yes, and especially the fat ones. This is.
Tom said you got worms. You gotta put it down somewhere else. And she looking at me like, "Man, what the fuck are you talking about?" This phone said you got worms. Goddamn, you gotta go down.
Hey, you gotta go sit down, nigga. I don't even let my dogs around me no more. But I ain't gonna touch them motherfuckers at all, nigga. Can't come near me, bitch. Fuck on.
Are you queer?
Yes.
Would you go to Israel?
I would go to Palestine.
Even though, wait, but if you went to Palestine, you'd be thrown off of a building for being gay. Do you love Palestine?
Yeah, why not?
Even though you wouldn't be allowed to be yourself there?
I feel like they're not supposed to judge, even if they have a set mindset. It is actually very haram in the Muslim culture for them to judge.
You don't even know what haram
What should be done
means.
to gay people? الحكم للي بده يمشي في هاي الطريق ويمشي في هاي الطريق يطبق حكم الإسلام عليه للفاعل والمفعول به.
In your opinion, what is worse, a child who is gay or a child who's a drug addict?
الأسوأ اللواط الأسوأ.
What is worse, a child who's gay or a child who's a thief?
شاذ جنسيا.
What about a murderer?
اثنين سيئين.
Them niggas going to Palestine and die, nigga. What you say?
What's that say right there?
I don't know what the fuck.
Dyke, I don't know what the fuck that is, but okay, then she got a little stomach out. I noticed something too. It's a lot of people with these signs. I don't know if this is America or somewhere else, but none of these people has parasites.
No, them bitches got parasites, nigga.
You think they do?
Oh, I
ain't seeing no malnourished. Everybody got stomachs hanging over their clothes and shit. Ain't nobody malnourished.
Yeah, that's true, but that's okay. They got
that's inflammation caused from parasites, sir.
Oh, okay. That's why they got 3 stomachs.
That's why they got packles.
All right. So I got this for you, OG. I want you to explain this to me real quick because we got a minute and some change. I might put it out 5 minutes, but I need you to explain to me what this nigga what they did to this nigga and how they fucked this nigga head up. Go ahead.
Women, naturally born women who think that trans women...
A sign, not naturally born. Again, not naturally born. Nothing about it is natural.
I told you I make mistakes.
Nothing about that is natural.
Okay, so what I'm saying is, for women, what's the language I should say?
Nothing about being born is natural. Being born like a normal person, OG, woman or a man.
Sir, it's just a clump of cells, sir.
Well,
It's
nothing
a
about
parasite
being
in
born.
itself.
Yeah, but nothing being born and being born a man is not normal, and born a woman is not natural. But I don't understand what they're saying. I want OG to explain to me because he speak nigga.
Assigned female at birth.
Okay, so for women who are assigned female at birth and stick to that,
and for whom that is
designation,
consistent with how they identify,
and for whom that's a lot of words. Who
stick with it?
Okay,
you are in a commitment for a stance.
Yes,
do the
ma'am.
work.
Yes, ma'am.
Do the
Here we go.
work.
Come on.
Teach me. Say it again.
Do the work.
Do it again.
For whom?
For whom?
It's consistent with how they identify.
Okay, so for women who were assigned female at birth and it's consistent with how they identify.
That's right.
Right.
For all of you cisgender women, naturally born women who think that trans women...
A sign, not naturally born. Again, not naturally born.
Not naturally born. That shit. Can you explain what the fuck that nigga just said?
I thought he was talking about people who came out of a woman's womb, are naturally born by a woman.
Okay.
Unless you was made and incubated in, a little embryo or something with a machine, and you came out like a old boy off of that one movie, Victor.
Predator? Oh yeah, okay.
I'm talking about Victor off of I think it's Underworld.
Okay, yeah.
No. Let me take that back. It's Blade 2.
Okay. Oh yeah.
They created the vampire, the extra species. Yeah, unless y'all niggas coming out with tails like Goku now. I mean, I don't know what the fuck to tell you.
Goku has a tail?
Yeah, he's not human, so he's a Saiyan.
Oh, I didn't know none of that.
Yeah, he was born with a tail. He just cut it off.
Oh, okay. Yeah, I don't know none of that shit.
So I'm like, yeah, he was human. I mean,
parasites cause inflammation. That's a fact, Boston Christian. Here we go.
We're not born naturally.
I was born naturally. I don't know about a nigga. I slid the fuck up out. I almost fell off the goddamn table because my mom and dad was in there by themselves. I almost fell off the table.
What did that mean to you and Mayo? Y'all give me what y'all thought about it. That's what I got from. I thought he was talking about people who came out of the vagina. I mean, what the other three was talking about?
They were saying that people aren't naturally born male or female.
That's goddamn lie.
They were assigned. They wasn't born naturally. They were assigned. Yeah.
By who?
Based on their biology.
The doctor. Not by biology, but by the doctor.
Yeah.
What?
Yeah. Because now the new thing in today's age is we have a lot of intersection. We know that that's probably 0.000000001% of the motherfucking population.
Mm-hmm.
But now everyone people that they know, they say they're intersex, which is not true.
And they're not.
Yeah. I don't even know what is that?
When you have both sexes.
People born with twigs and berries and a vagina.
Yeah.
A mutation.
Yeah. They're trying to say that everyone's trying to say they know someone that was born that way.
So let me ask you, and this is just me going a crazy rant because y'all want to take it there. So what about the person who is born like that, and we're gonna take us out of it because we regular all of a sudden. The person, because we only got one, and then our significant others have the other part. So this person that's not us, they born with both of them, right? Let's just go ahead and say that they'll still be divided because again, what if a class of those people have, and we only talk about the ones that was born with both of them, had the male genital on top, and then you have another half that have the other parts on top. Wouldn't that still make you two motherfuckers? Even though you still have all three parts, would that still make you the same just because you have the same parts, but they in a different location? But you have others who have been in the same location as you.
Yeah, it would still be the same thing. But the thing about that is only one of them things work, whether it's the dick and balls or the pussies.
Yeah.
They both don't work at the same time.
Usually neither of them work. Fully.
No, that's not true. That's not true.
Yes,
Most,
sir.
no.
Most
One
of them
work.
are unable to breed, sir, successfully.
Yes, to breed, but that one of them actually
that's what I mean
works.
by functional,
Okay. I got you. All right.
Yeah,
So we go
whatever which one worked, that's the team you got to go with. If you on that side, if you unisex, if your meat piece worked, and you guess what, you a unisex mate. But the other piece worked and the other piece doesn't work, guess what, you is a unisex woman. And then I guess you want to go from there. I mean, I would make it stupid enough to be like that because, again, I wasn't born with all that. And just because you anomaly with it doesn't give you the choice to make like, oh, however yours come out. Oh, just because we was born with it that we get, no, bro. We got to do like everybody else. It's 2 years. It'll be the same.
I don't want to hear no antibacterial bullshit when there's a whole bunch of it's not even it's nothing but bacteria and cow shit.
Look at this nigga B-Rad. What's going on here?
What up, B-Rad? Anyway, we're going to end this show today like I did the other day.
She is cursed.
Hold on.
Her coochie is cursed in a good way. That thing ain't normal, not even on a good day. It helps my soul and drains my bone. Her kitty's so tight, stretching it, I can.
Oh, son of a bitch. I hit the wrong goddamn button. That shit was.
Damn it, Tom.
It's still on.
I got it. Oh, I didn't necessarily get rid of it. Hold on. Let me put it back up here. Fucked it up.
Yeah, you sure did. And we say you still on.
Oh, yeah, I'm still on. Yeah.
Her coochie is cursed in a good way. That thing ain't normal, not even on a good day. It helps my soul and drains my bone. Her kitty's so tight, stretching it, I can condone. Lips so slick, they slap like a whip. Had me tongue-tied while I took the trip. Every stroke feels like a heaven-born curse. Left me moaning hard, rehearsing in verse. She's a freak, and I'm a damn fool. Rides me raw like I'm breaking the rule. Boots on the bed, spurs dig my skin. Screaming my name while I dive back in. It's wrong, it's wild, it's hotter than hell. And I'd crawl back in just to bust one well.
You wanna party with a fat bitch, even though in comments you're like, cap bitch. Time you spend with me will be time well spent, and if I get on top, you know I'm leaving a dent. Know you wanna party with a fat bitch, buy me diamonds, give me name brand chips. Time you spend with me will be time well spent, and if I get on top, you know I'm leaving a dent. I'm a big bad, big butt, big dreams baddie. 2 minutes with me and you'll be calling me daddy. Might not pass the presidential fitness test, but notify your next of kin, I'll put you to rest. Whiny little dudes say, I'm concerned for your health. And think about my back rolls while they're touching themselves. They comment, I legitimately thought this was John Candy. Then whisper my name as they start to get randy.